each crisis matters because it can cause both acute and chronic complications. Pain, it's obviously the most common acute complication, and I always say anywhere blood can travel, sickle cell can affect, which is why we can have pain anywhere in the body, but there's also a reason why we can have head to toe complications as well. So let's dive into the acute complications first. So again, those acute vascular events are those sudden or short episodes caused by that sickled hemoglobin and hemolysis. I'm going to touch just briefly on acute management at a hospital, and then I'm going to run through all of these acute complications, and then we'll get into the chronic complications. Now, when somebody's at the hospital and having a crisis, pain management is obviously central for this person. They will likely need IV fluids. And I just wanted to put this out there because a lot of times people aren't really looking at what type of IV fluid you're getting. But there's different types. You can have normal saline, half normal saline, lactated ringer, and they differ slightly based on what the components that they're made up of. So you have half normal saline that the tonicity or just the composition of the fluid determines where that fluid actually goes. So normal saline has the same tonicity as our plasma. So when you're getting normal saline, it's just putting the hydration and the fluid in your blood vessel. When you use half normal saline, it actually pushes the fluids inside the cells, and a lot of times these cells are dehydrated. So in the hospital setting, we usually use half normal saline. There might be certain reasons why you might want a different fluid formulation, but I did want to mention that because I know when I've spoken about this in the past, a lot of warriors were like, oh, I never even knew that. Pain management is obviously the most important thing because if you were able to manage the pain at home with your home regimen, you wouldn't be in the hospital. So there's different methods for pain. You can get a PCA pump, which a lot of hospitals are using. Some of my patients like it because it really does empower them. You don't have to wait for the nurse. You can control when you're getting the doses. But other patients feel like they need those IV boluses, which is when you're getting maybe 2 milligrams of Dilaudid every 3 hours and you're getting that one IV push. You can also get intramuscular injections, maybe if you have poor venous access or they can't get an IV on you in the ER, I'll do an IM injection just so I can give you some pain relief while we're waiting to get that midline or PICC line placed. We also think it's very important not to just use pain medication as needed. Like if somebody's admitted for a crisis, you shouldn't just have Dilaudid PRN or Dilaudid as needed as the sole pain management therapy. We like including both short-acting and long-acting medications because when you think about how pain medication works, when you're using IV medicine, it peaks really fast. So you have that rapid onset and you get the pain relief quickly, but alternatively, it gets cleared from your body much faster. When you take oral medications, it takes a little bit longer to get into your system, but it stays in your system much longer. So having both the orals and the IV medication is very beneficial because then you can kind of stagger the doses and alternate the IV and the oral to just keep more of a steady responsive pain medication in your system. When someone's having a sickle cell crisis, your body's in this inflammatory state. Narcotics just turn off a pain switch in your brain, but it's a Band-Aid. It's not actually addressing what's happening internally, where anti-inflammatories is actually addressing the inflammatory response. So for my adults who have been using narcotics their entire life, I do not expect you to get any type of pain relief from an anti-inflammatory, but it is definitely a great adjunctive therapy. And for people who don't get crisis, often sometimes just taking an naproxen or an anti-inflammatory at the onset of a mild pain crisis might be enough. But you do need to be mindful if you have kidney disease or if you have peptic ulcers or bleeding disorders. So this is all general recommendations, but at the end of the day, please speak with your providers who knows the medical history and can give you more tailored individual recommendations. Supplemental oxygen might be necessary. Incentive spirometer is so important, and I'll go a little bit deeper into that, but that helps just prevent developing pneumonia as a complication. You might need blood or exchange transfusions, maybe if you have stroke or multi-organ failure or a case of severe acute chest syndrome. And then you want to monitor for infection and complications. So again, there really is so much more than just pain and anemia, knowing that we can have head to toe complications. If somebody has certain complaints or having the worst headache, you definitely want to explore that further before just blaming, oh, it's just a sickle cell crisis. So first complication we are going to discuss, or I guess second, because your VOCs was that first one, is acute chest syndrome, which if you didn't know is the #1 cause of death in sickle cell. Acute chest is basically a constellation of symptoms like having fever, shortness of breath, low oxygen, with evidence or radiographic evidence of pneumonia or consolidation. So this could be from X-ray or CT scan. We see it occurs in around 10 to 20% of hospitalized patients with sickle cell, and it's usually 1 to 3 days after being admitted for a severe VOC. Infection is the most common cause, but there are other causes that can be seen. And usually in the adults, we could see maybe having a lung or a rib infarct. That's when you're having sickled hemoglobin that's blocking blood supply to the lungs. You even could have it from developing blood clots causing acute chest. Over sedation from narcotics. We know narcotics can slow down everything, including your breathing. So if you have narcotics that are making you breathe very slowly, you're breathing in less oxygen, you might not be breathing as deeply as well, that potentially could progress to acute chest syndrome. Now, something I just want to call out, because I've had 2 patients in the past few months admitted with this, and it's kind of one of the scariest complications from sickle cell, because if it's not caught early, the prognosis is very bad, and that's a fat embolism. If you have a patient who is presenting with acute respiratory symptoms, so all of a sudden they're having really difficulty breathing, maybe having shortness of breath, low oxygen, a fast heart or respiratory rate, and they're starting to have altered mental status, so maybe they're getting a little bit confused, and this follows having severe bone pain. So you have a patient admitted for a vaso-occlusive crisis, they're having really intense bone pain, all of a sudden they're developing respiratory symptoms and confusion. 100% you want to rule out a fat embolism, because initiating treatment early is the key to the best prognosis for that. So how do we manage this? Intensive spirometer and deep breathing is imperative. When you're having chest pain, it makes sense to breathe shallow because it hurts, but we need to have full inhalation, because at the bases of our lungs is where oxygen is exchanged for carbon dioxide. And those deep breaths also helps aerate the lungs. So you should have an incentive spirometer. And the key with the incentive spirometer isn't to just do it quickly and go, you really want to keep that ball steady and do a very slow inhalation to keep it in. So for my patients who don't have an incentive spirometer, I always do the 3-3-3 breath method, where you breathe in for 3, hold for 3, blow out for 3. And this is going to help prevent pneumonia, but if you have pneumonia, it's going to help speed up the recovery for it. If you have children, obviously, I don't expect a 3-year-old to be able to use an incentive spirometer and follow those instructions. So something like blowing bubbles, or getting one of those pinwheels that you have to blow, or putting ping pong balls on a table and having them blow it across the table and creating a game out of it. There's different ways to accomplish deep breathing without having to use an actual device. You might require antibiotics. We want to avoid fluid overload. So a lot of times people think more fluid is better, but sometimes if it's too much fluid, it kind of gets pushed out in different spaces, and that can cause it to be fluid overload in the lungs and lead to shortness of breath. Depending on hypoxia or how low the oxygen is, you might require a blood transfusion, either a simple transfusion or an exchange, which is when we give blood and we take your sickled hemoglobin out. Pain medication, breathing treatments, you definitely want to get out of bed. I usually recommend getting out of bed and walking around 2 to 3 times a day, taking those cleansing breaths several times a day while awake, and continuing that when you are discharged from the hospital, because most patients aren't going to be discharged with complete resolution. So we just want to help with that recovery, and really just deep breathe despite the pain. So maybe time your breathing when you're getting your pain medication, so you can really help, because that is the most imperative thing to help with that recovery process. Next complication is bone infarct, which is when you have sickled hemoglobin blocking off blood supply to a bone, where you get really acute and sudden pain. So signs and symptoms can be really intense pain with light palpation. I mean, sometimes just gently tapping, you don't have to do it hard, just provokes a lot of pain. You might have pain with breathing. This is what we call pleuritic pain, and maybe some swelling. But the most important thing with this is taking anti-inflammatories. Yes, you're probably going to need narcotics depending on your tolerance and what your management is to help with the pain, but the anti-inflammatories are very helpful to help reduce the swelling, to help restore blood flow. This could be your NSAIDs like naproxen, ibuprofen, Motrin. There's also topical NSAIDs such as Voltaren gel. So I have patients sometimes who they get it on their shins. They get that intense bone infarct. We're just lightly tapping the shin is intense pain. So using a heating pad to help dilate the vessels, they'll rub the Voltaren gel, and that definitely helps prevent that. If you have a bone infarct, it does have the possibility of leading to osteomyelitis, which is a bone infection, especially if there's already an infection in your system. So if you're having the intense bone pain, but you're also having redness, swelling, any type of drainage, or it's just not going away, this should be in the back of your mind, and we can either do blood tests, even different types of bone scan to try to rule this out if there is that concern. And then lastly, when you have repeated bone infarcts over time, it can cause avascular necrosis, which we'll be covering in the chronic complication section. Next up is priapism, and this slide is just showing my maturity level. So on the right-hand side, this is Priapus, and he is the Greek god of fertility and was known for his oversized and permanent erection, which is where sickle cell complication got its name from. So priapism is a persistent and prolonged painful erection, and it is not sexually related. It's essentially related to when you have sickled hemoglobin blocking the outflow of blood from the penile shaft. So you have all of this sickled hemoglobin accumulating in the penis and it can't go out. So you have the prolonged painful erection. And we see it in around 20% of men. But I honestly think it's probably underreported because it might not be discussed, and a lot of our adolescents might be embarrassed about it. So this is a question I ask all of my men because I bring everything up matter of fact. I think when you're very objective with your conversations, it just makes patients feel more comfortable. So I think if you have a son, just bring it up like, hey, I learned about this complication. Is this something that you're going through? Because if it's untreated, it can lead to infertility. Management includes fluids and activities. Sometimes you can just walk it off or take a hot shower. If you're noticing it happening more frequently, Sudafed over the counter usually is our go-to strategy. There's something called stuttering priapism where it goes up and then it comes down a little, then comes up again. So when we're having that stuttering priapism, usually I recommend taking Sudafed nightly for several nights until it goes away. But if we feel like it's recurrence, we can't get control over it with those simple strategies, we do have prescription medications for it. And I have had several patients actually have to go under surgical management in order to fully resolve this issue. Next up is gallstones, which is a fairly common complication in sickle cell because of the hemolysis or red cell breakdown. Now, the main purpose of the gallbladder is to store and release bile, which is made in the liver, and it helps break down fatty foods in the small intestine. We have a small tract called the bile duct, which is where bile flows from the liver to the gallbladder. And now for the general public, people who develop gallstones, it's usually related to having a fatty diet, obesity, low fiber, if you're a heavy alcohol drinker or high cholesterol. But in sickle cell, the main reason we see gallstones is because when you have that rapid hemolysis or red cells being broken down, bilirubin accumulates, and it's that bilirubin accumulation which is causing those gallstones. We see it most commonly in individuals aged 11 to 29 years old, and you might complain of abdominal pain, nausea, vomiting, and bloating. Sometimes the abdominal pain will actually radiate to your back. There could be fever, jaundice, or yellowing of your eyes. You might notice dark urine, like a tea-colored urine, or even clay and light-colored stools. Treatment is going to include antibiotics and pain medication. We don't do surgery in that acute setting. And interestingly, for the general population, we don't always remove the gallbladder if you have gallstones, but there are special populations that we do remove it, including sickle cell, because just knowing that it's from bilirubin accumulation, and this is a condition characterized by hemolysis, you're at higher rate for having this again. So we try to do a cholecystectomy or removal of the gallbladder. Once the crisis is resolved, we'll do it when you're feeling well, just knowing that surgery can trigger a crisis. You never want to undergo an elective surgery if you're having a crisis. General management includes a low-fat diet and avoid greasy foods. There's some studies that show drinking coffee can actually decrease the risk of gallstones. So any of my coffee addicts like myself, I feel like we're doing something healthy for our gallbladder. Regular exercise is really important because inactivity, heavy alcohol drinking, dehydration are all different risk factors. So you definitely want to be mindful about your diet, high fiber fluids, avoid smoking, and then just limiting your alcohol intake. Next up is stroke. A stroke essentially occurs when you're having a disruption of blood flow in the brain. You can either have an ischemic stroke, which is when you're having no blood to a portion of the brain, or you can have a hemorrhagic stroke, which is when there's actually a bleed inside the brain. 10% of individuals with sickle cell will have a stroke by the age of 12, and we see it most frequently between the ages of 3 and 10. Knowing this statistic is why it is in the sickle cell guidelines that patients should be screened with a transcranial Doppler beginning at the age of 2. A transcranial Doppler is basically an ultrasound of the brain, and they're looking at the cranial vessels. And if they see that it has a high velocity, that is an individual who will be at high risk for developing a stroke because they're looking at the blood flow. And if it's a high velocity, that's essentially saying that the blood is having to squeeze through a more narrow vessel. And patients who have an abnormal Doppler usually will be started on a transfusion therapy. We also consider hydroxyurea therapy. Anybody who has an overt stroke or even just a stroke in general, they're going to be started on transfusion therapy. And in adults is sometimes when we reconsider, do we want to adjust that maybe to exchange transfusions, or depending on what their complications and history looks like, maybe hydroxyurea is important. But in the acute setting, they're definitely going to require blood, maybe an exchange transfusion. It kind of depends on the facility and what they have availability of. And then other indications for blood transfusions in that acute setting include, again, that multi-organ failure and somebody with severe acute chest syndrome. So this is somebody who's very hypoxic. They're not maintaining good oxygen levels. Now let's talk about how sickle cell can affect the eyes. It can cause an acute retinal hemorrhage and cause blindness. This isn't something that just happens overnight. It's a complication that we see most commonly in hemoglobin SC. Around 70% of patients with hemoglobin SC genotype will have this, compared to only around 15% in SS. The way it works is, say you have a sickled hemoglobin blocking one of the vessels in the eye. The body forms these branches or these collateral vessels from that blocked blood flow, and these collateral vessels serve zero function at all. And if those vessels bleed, that's when you can get this complication and lose vision in your eyes. Somebody can present with sudden vision loss. It's usually going to be one eye. If you're getting blurred vision in both eyes, this is likely a refractory issue and you might need glasses, nearsighted, farsighted. But if it's one eye specifically that's affected, you might be seeing floaters. Definitely want to get that checked out because you only have two eyes, and we definitely want to make sure that they stay good, because some patients it's reversible. Other patients, depending on the degree of it, you could have permanent vision loss. Treatment includes laser treatment. So we want you to get your dilated eye exam beginning at the age of 10. And you don't want to just go to a vision or a lens crafters. You want to see an ophthalmologist who really knows what to look for in a patient with sickle cell. So they'll look deep in the vessels in your eyes. If they see any of those branches or collateral vessels that I had mentioned, they can laser them away before they even have the option to cause any issues. Some patients will go on hydroxyurea. For hemoglobin SS and S beta thal 0, they should be on hydroxyurea. That's like a standard of care. It's a life-saving treatment. But for hemoglobin SC, the recommendations aren't as clear. So usually an SC patient on hydroxyurea is going to be somebody who's having a lot of pain crises, or if they're having organ damage, or one really bad case of acute chest. But I do have several patients with hemoglobin SC who are on hydroxyurea because they have just a rapidly progressing sickle cell retinopathy. And that's just every follow-up visit that they're seeing new vessels, they're having worsening of their vision. So we're trying to mitigate that by starting on hydroxyurea usage. Now we are going to discuss our chronic complications highlighted here, with the first one being pulmonary hypertension. You can see it affects around 10% of individuals with sickle cell disease, and it is associated with an increased risk of death. Anemia and hemolysis, or that red cell breakdown, increases the risk of pulmonary hypertension because of the effects of hypoxia or low oxygen, and longstanding anemia increases the cardiac output. So when your body is anemic, remember your red cells are what binds oxygen and carries it throughout our entire body. So if your body feels like it's not getting enough oxygen, the heart works hard and is pumping harder in order to pump more blood and circulate more oxygen from the body. That, coupled with hemolysis, which we learned again causes the free hemoglobin and releases all the cellular contents, which binds nitric oxide and causes more vasoconstriction, increases the pressure that the body has to work under, and over time can cause pulmonary hypertension. The biggest symptom for this is if you get short of breath with little activity. So say all of a sudden it's just like parking your car and walking to Publix, you get winded. That's a red flag. Yes, anemia can cause shortness of breath with little activity, but say you got your blood transfusion and you're still short of breath with little activity, definitely want to rule this out. I've mentioned that there are sickle cell guidelines, and we used to have guidelines that would have us do screening echocardiograms or ultrasounds of the heart every 2 years in individuals with sickle cell. But in 2014, they got rid of that recommendation. And it's because when you have a positive echocardiogram or the heart pressures are elevated, we have to follow it up with a cardiac catheterization, because an echocardiogram, it's subjective. Like if I were to do the test and another radiographer were to do the test, we could have different results. It's a subjective test, but it's a screening test. And we found when we were sending the patients with positive results to cardiac catheterization, there were a lot of false positives. With a cardiac catheterization, it's an invasive procedure where they put a catheter either through your wrist or through your groin, and the catheter goes into the heart in order to allow us to objectively measure your heart pressures. And when they were measured, a lot of patients had normal heart pressure. So that means that the echo was falsely positive. And since we were seeing a lot of those false positives, the guidelines now recommend doing echocardiograms or ultrasounds of the hearts for individuals with symptoms such as shortness of breath with low activity, or those who are already known to have pre-existing heart or valvular dysfunction. Treatment, we usually will refer to a pulmonologist. We're lucky at University of Miami because we have a pulmonologist with a specific interest in sickle cell and pulmonary hypertension. Anything that is preventing vaso-occlusive crises and stabilizing your hemoglobin and reducing the anemia and hemolysis is going to help manage pulmonary hypertension. So that's why hydroxyurea is helpful. I do have several patients who are on a chronic transfusion or chronic exchange transfusion as management for their pulmonary hypertension as well. When somebody gets a little bit more severe, that's when there's pulmonary specific medications to treat pulmonary hypertension. However, that's not prescribed by your hematologist. That's going to be prescribed by the pulmonologist. And you can see a couple of them: macitentan, sildenafil. Sildenafil is Viagra, which you might be like, why is this the case? But since it dilates, it helps with the nitric oxide. It's going to dilate the vessels and help decrease the pressures. So we discussed bone infarcts. So again, that bone infarct is when you have sickled hemoglobin that's blocking blood flow to the bone. But if this occurs repeatedly over time, you are going to start getting damage and deformity to that bony structure. You can see the different risk factors. It actually occurs at even rates across all hemoglobin genotypes, but we see it occurring earlier in those with hemoglobin SS and those with hemoglobin SS with alpha thalassemia trait. Older age, male, obesity, those are all risk factors. And obesity makes sense because if you're overweight, you're putting a lot of excess pressure on your hips, your knees, your ankles, and that extra pressure is contributing to more wear and tear of that joint. Having a low bone mineral density like osteoporosis or osteopenia, this is a big one and is a reason why I check all of my patients for vitamin D, because Florida, being the sunny state of Florida, we actually have the highest rate of vitamin D deficiency. And people of color, the more melanin that you have in your skin, the less vitamin D you absorb from the sun. Vitamin D is extremely important to allow your body to absorb calcium to keep your bones strong. There's also data that shows that low vitamin D can actually increase sickle cell pain. You need vitamin D for your nerve health, for your teeth. So vitamin D is extremely important. So everybody should make sure that level is checked for them. And I would say probably 90% of my patients are on a vitamin D supplement. Almost everybody is deficient with sickle cell. It's interesting. Other non-sickle cell related risk factors for avascular necrosis includes long-term steroid usage, if you drink a lot of alcohol, smoking, cardiovascular disease, any type of joint trauma. Signs and symptoms early, usually you don't have any. You might notice like every time you're getting a crisis, it's always localized to your hip maybe, but in the early stages, it's not visible on x-ray. So looking at this top image, the first one on the left-hand side, our hip joint is a ball and socket, and it moves nicely through that ball and socket. And then you can see as it progresses, you can see that, I wish I had a pointer. I don't know how to do this, but you can see in the first image, it's nice. You can see there's a nice cartilage space in between the bone, the ball and socket joints, and the bone itself is pretty smooth. In the middle, you can start seeing there's more irregularities, but that joint space is starting to narrow. And in the third image, you can see that bone is just not smooth at all. It's really irregular, and it actually looks like there's collapse where it's bone on bone. So as the disease progresses is when the pain begins. It might start with just pain with activity, but as you get to the later stages, it's stage 1, 2, 3, and 4. Once you get to stage 4, that's usually when you're getting pain at rest. The most commonly affected joint is your hip, followed by your knee and your shoulder. Management includes weight management, again, because if you're having any excess weight, especially if it's AVN of your lower extremity, so hip or lower, that's a lot of extra pressure and work that your body is having to use. Physical therapy, I think, is one of the most underutilized resources across every disease state. But at the end of the day, if you can tolerate physical therapy and really strengthen that supporting joint structure, the muscles, the tendons, the ligaments of that joint, it's going to decrease the workload of habits as well. There's a procedure called a core decompression or a hip coring, which is suitable for some patients, but you have to catch it at the right spot, because if it's too advanced, you're not going to benefit from it. And it's not a cure, but it's going to delay the need ultimately for a hip replacement or a joint replacement, because that's the only curative treatments of AVN. With core decompression, it sounds worse than it is, but they'll drill into the hip joint and they remove a very small tip of bone. They put the rest of the bone back, and removing that little piece helps restore some blood flow and can help reduce the pain. But ultimately, that joint replacement is going to be the curative approach. If you have a vascular necrosis of your shoulders, I always say use your other shoulder to carry your purse and bags and whatnot, because again, if you're wearing a purse, that's going to put extra weight and pressure, which can then speed up the progression. Sickle cell ulcers are a complication of both sickle cell, but it can rarely be a side effect of hydroxyurea as well. And it's essentially a skin breakdown or ulceration. It most commonly happens on the ankles or on the top of the foot, and they're very painful and they take a very long time to heal. It most commonly is seen in hemoglobin SS, and it's really related to the low anemia and the hemolysis. And patients might say it starts looking like a mosquito bite, and then when that overlying skin breaks down, all of a sudden there's this huge wound, and it's like, whoa, where did this come from? Management includes elevating the legs, wearing compression socks. There's some data that the medication voxelotor or Oxbryta can actually help with that. So sometimes I'll have patients with ulcers, I will put them on voxelotor in order to help with healing. And the key is doing wet to dry dressings. The next few pictures I'm going to show, they are more graphic. So if you have a queasy stomach, just close your eyes. But here are what sickle cell ulcers actually look like. And you can see on most of these, there's yellow tissue, and that yellow is slough. If you don't remove that slough tissue or that black eschar tissue, your wound is not going to heal. We want to see that nice beefy red granulation tissue in order for it to heal. And we remove the dead skin with wet to dry dressings, and don't just fold your gauze and put it down. Like when you take your gauze, you really want to, I always say, feather it. So when you take a piece of gauze, you kind of just want to push and create all these little different nooks of cranny. And this is wet, you put it on your wounds, and then you put a piece of dry gauze on top of it. So when it dries and you remove this, it traps in all of those little dead cells in the gauze to help it remove the dead tissue to allow for healing. So you want to do this frequently, minimum of twice a day. Wear your compression socks, because if you're on your feet a lot, gravity kicks in and it's going to cause all the blood to go to your ankles. It pushes outward, increases that pressure, and can help delay healing further. We also sometimes will do blood transfusions or exchange transfusions for people with ulcers. On the adult side, we'll really use exchange transfusions more than simple transfusions, because every time you're giving a simple blood transfusion, you're putting more iron into a body. And for a man who doesn't have a period, there's no way to get rid of that excess iron. So with an exchange, we're not putting as much iron, and long term, it's a better approach for adults. So in addition to those with sickle cell ulcers, sometimes we will do chronic exchanges for those with stroke. If you're unable to take hydroxyurea, so maybe you're compliant with it, but you're still having a lot of crises and it's just, you're not responding to it, or your platelet count is just way too low to be on hydroxyurea, or you have non-healing sickle cell ulcers, those are all indications to go in an exchange. Anybody with chronic recurring VOCs or acute chest, despite being on hydroxyurea and other medication management, will be a reason to go on it, as well as severe pulmonary hypertension. Next, I want to touch on hemochromatosis, which is iron overload. So people who are on simple transfusions or receiving blood often can then develop iron overload. You can have hereditary hemochromatosis, which is where you have a genetic mutation that causes you to have more iron, but more commonly you can have secondary hemochromatosis, which is our thalassemia and sickle cell patients who get iron overload from just repeated blood transfusions from over the years. We diagnose this from having an elevated ferritin. We sometimes can see an MRI have confirmation of iron deposits in the liver. And the problem with iron overload and why it's so important to address is because iron can deposit anywhere on the body. You can see on the right-hand side, every organ it can deposit on. It can deposit on your liver and cause scarring of the liver. It can deposit on your heart. It can even deposit on your joints and contribute to joint pain. It can deposit on your pancreas and lead to diabetes. It can deposit in your brain and cause fertility issues. So it's extremely important to be on iron chelators, which are medications that will bind the iron and remove it. If you're a woman and you're having periods, great, you're losing iron that way. But again, men don't really bleed unless you're stabbing them or something. So we need these medications to remove the excess iron. The chelator options we have are deferoxamine, which is like Desferal, which can be given subcutaneous or IV. Considerations for this one will be, it can cause toxicity for both hearing and with your eyes. So just make sure you're up to date with your annual eye exams and get your hearing checked. God forbid you have any vision, hearing things. Deferoxarox is Jade-Nu or X-Jade, which is an oral version. X-Jade is the powder, while Jade-Nu are the tablets. Compliance is always an issue because we see that nausea, vomiting, diarrhea, GI upset are the most common side effects. It also can affect the kidney. So if you have any type of kidney damage, not necessarily the best option. Deferoprone, which is the last one, this is Feraprox, is a good option for people with kidney issues because the other two are metabolized and can cause damage to the kidney. The one thing with this formulation is it can affect the bone marrow. So we just want to make sure we're checking your CBCs and making sure it's not having any adverse effect. Sickle cell can cause nephropathy, which is when your kidneys are affected. Risk factors are those with severe anemia, recurrent acute chest or VOCs, or any underlying condition that affects your vascular system, such as hypertension and diabetes. The key with any disorder, disease, etc., is early detection. So we do screening tests. I'll check my patients for protein in their urine at least once a year. Usually screening begins around the age of 12. You can do a urinalysis because in theory, your kidneys are what's metabolizing and filtering protein and other contents in our blood. And if protein is a bigger molecule is being pushed into the urine, that means your kidneys aren't functioning. And it's one of the earliest signs of kidney damage. The microalbumin creatinine ratio is the best lab test that I like to do, which is a urine test. But if not, a urinalysis that shows protein is an early sign. I will never start medicine just from one abnormal, but if we're seeing repeated high protein levels, that would be a reason to treat. Fluids is the most important thing because not even talking about sickle cell, when somebody is dehydrated, our body goes into this conservation method and it will divert blood flow to your essential organs, which is your brain and your heart. Kidneys get neglected and you can get an acute kidney injury. Now we have sickle cell. When you become dehydrated, you can have a sickle cell crisis and all of that can damage your kidneys too. So it is so important to make sure you're staying hydrated to keep the kidneys healthy. Hydroxyurea literally protects your organs. It's the only medicine I can say is going to make you live longer. It prevents those microvascular complications and protects every single organ, and it can actually reverse kidney damage as well. ACE or ARBs are a type of blood pressure medications. They are never used by itself, though, for blood pressure. It's usually in combination, but we're using these medications because it dilates the vessels that enter and exit the kidneys, and by doing so, decreases the workload of the kidneys, and it can reverse kidney damage and protect from future damage. If people, though, have more chronic kidney disease and it's long-standing, your kidneys are what are responsible for releasing erythropoietin, and erythropoietin is the stimulus for our body to produce new hemoglobin. So if you're having kidney damage, you might not really have that stimulus to produce new hemoglobin, in which case we then have erythropoiesis stimulating agents such as Procrit or Retacrit, Aranesp that help stimulate red cell production. Now, people might be thinking, if we have something that stimulates red cells, why aren't all the patients on this medicine? And it's you don't want to stimulate more sickled cells. So a lot of times when we're using these agents, it's in combination with hydroxyurea, because hydrea is helping you produce more stable hemoglobin. And then when you're taking these injectable medications to produce new hemoglobin, it's going to produce more of that hemoglobin, because you don't usually use this by itself, because then you're just going to trigger more sickled hemoglobin production, and it's kind of counterintuitive. Then lastly, I just wanted to touch on the mental effects, both for patients and caregivers. I think we can all agree there is a huge psychological burden living with sickle cell disease, both because of the disease itself and just the stigmatization of the disorder, which is worsened by healthcare providers. We know sickle cell can affect somebody's ability to learn, pay attention, even affect their mood. You can see some stats here that 67% of individuals avoid going to the emergency room because they want to avoid judgment and mistreatment. 50% feel like the providers don't care about them. So you can understand there's a lot of medical PTSD or post-traumatic stress disorder for patients living with sickle cell, and mental health negatively impacts physical health. So if you have this medical PTSD, or you're having any type of negative emotions, that can worsen your sickle cell symptoms. And it really is a vicious cycle. We also need to remember that there's missed work and school from crises. Even if you don't go to the emergency room, it's almost hard that, like, you're sick, you're not sick enough to go to the hospital, but you're too sick to go to school or to work. And then for our caregivers who have to care for their children when they're getting called out, there's a lot of factors that are going to cause a negative mental impact as a result of sickle cell. And there's a lot of isolation. And as a result, we do see a lot of depression and anxiety. I think it was up to 35% of individuals with sickle cell have depression. And I think the key is just not to suffer in silence and realize you're not alone. I think is a huge stigma when it comes to talking about mental health. Our generation is totally doing awesome with kind of changing that and being more open, and just, I'm so vocal about it. But I think it's just so important that we do screening tests and we identify those who might have mental health issues, because if you're not addressing the mental health, a lot of times patients are just taking more and more narcotics because they're having more and more pain because of that negative mental health. When we can address that underlying cause is sometimes all we need to do. So we could do a whole presentation on mental health, but I'm just going to do my quick tips of stress management. For me, I'm such a people pleaser perfectionist, and 2022 was my year of self-healing, and therapy was a godsend. And it really taught me that it is okay to set boundaries. It is okay to say no. It is okay to disappoint others, because at the end of the day, adults can be disappointed. We are grown-ups, and your mental health is more important at the end of the day. So learn to ask for help, set boundaries, learn to say no. It is totally okay. Self-care is key. If you're not taking care of yourself, and this is also for my caregivers, if you're always putting your child who has sickle cell first and you're neglecting your own health, that's terrible, because what if something happens to you? You need to take care of yourself and be healthy. So sometimes just scheduling time for yourself in your phone, and like put a 30-minute calendar, like something just for you. Maybe do some mindfulness or meditation. Like, I've just started my practice and I do meditation every morning, and it really just grounds me and kind of puts me in my zen, so I can feel like I can take on the day. Journaling is good, because I think when it comes to any type of issues, if we don't talk about it and you just leave it in your brain, our subconscious goes wild and just constantly thinks that sometimes just writing it out, it gets it off of your subconscious to stop ruminating on. Spending time outside. I mean, there are so many benefits of sunshine and sunlight, and getting vitamin D and improving mood and helping with depression. Exercising or getting the body moving. I'm the queen of spa. Like, all of my gifts are always a massage or facial or something. So for me, that is just one thing that will always relax me. But I think the key is just find something that you're doing for you to make you feel good, and just seek support, whether it's from family, friends, community, or professional help. So I know I spoke fast. I was just trying to get the time in and get everything in for questions. So I'd be happy to open up the floor to anybody who might have some questions at this time.
Well, that is that was one of the most thorough presentations about complications across the lifespan. So fabulous, fabulous. There are a couple of questions here that we want to add. So Tabitha said that she would like more information on what you mentioned about the anti-inflammatories, and is that used in emergency department settings or once a patient's admitted?
Sure. So I would, in the outpatient setting, when I have a patient who's having a sickle cell crisis, my goal is to keep you out of the emergency room. So if I have somebody who's contacting me, they're like, hey, I can't get any relief of my pain, with their, say they're just prescribed Percocet, my number one recommendation is always, let's try naproxen or an anti-inflammatory in combination. This is one instance where it's totally okay, in my professional opinion, ultimately ask your provider, but it's okay to take a narcotic with an anti-inflammatory because the mechanism of action is very separate and they have a synergistic or an additive effect. So that's at home. I think you can definitely start incorporating that for pain management. In the hospital setting or sometimes in the outpatient infusion, I order Toradol, which is an IV version of anti-inflammatory or an NSAID, and usually we'll do it for the first 48 hours. But it's important to realize that these medications, you can't use them if you have any type of kidney disease because it is metabolized through the kidney. If it's mild kidney disease, taking one dose here and there is okay, but it's definitely not something I'd want you to grab every single time you're having a crisis if it happens frequently. And it's very important to realize that you're taking it with food because it can cause gastritis and a lot of GI symptoms otherwise.
That's fabulous. Carla, do you want to go through the rest of the questions or should we take them towards the end? You're on mute, dear.
Okay, let's tag team.
All right.
All righty, so done.
Whatever's easiest. I have the chat pulled up, so I can just go down the list if you want to.
Okay, great.
We'll just keep it easy. So the next question is regarding gallstones. My 13-year-old daughter tested showing small gallstones and it was skipped over. And I found out when looking at her labs. How concerned should I be or should I not be concerned since she only expresses jaundice and nausea at times with abdominal pain, which can be linked to constipation. So I'm curious if you're saying, because gallstones, the only way to confirm is through an ultrasound or some type of imaging. So if you're saying the labs are how you saw them, that might be from the bilirubin increase. So bilirubin is going to rise anytime the body is breaking down hemoglobin. So when you're in the emergency room and the doctor's like, oh no, you're not having a crisis, they're looking at your bilirubin, but we know that labs don't always confirm crises. But if the bilirubin is elevated, that doesn't always mean somebody has gallstones. That's just letting us know the body is breaking down the hemoglobin. And jaundice is the only visible symptom of sickle cell. So if you see jaundice, that's usually when I tell my patients, let's pause, think about what you're doing that might be triggering a crisis. Is this a matter of you need more fluids? Or are you stressing yourself out? Or are you overdoing it and just need to relax? Or do you have respiratory symptoms or urinary symptoms that could be showing that this is what's starting to trigger a crisis? Now, if she's having abdominal pain and nausea, I'd want to know, when is it happening? Is there an association with food or time of day? If she's always getting nausea and abdominal pain when she's having a fatty or greasy meal, I would talk to her provider then and let them know so they can do scanning. And if she does in fact have gallstones, and actually like very large gallstones too, that is an indication to consider for getting removal. Constipation is common because narcotics slow down everything, including the motility in your GI. So if you're constipated, you're just kind of having a backup. So anytime you eat, you can get the abdominal pain, the nausea, etc. So this is where fluids are really important because the kidneys get neglected when you're dehydrated, but they're also your bowels. The water is drawn out from your bowels when you're dehydrated. So if you're noticing duty balls when you're pooping, that is a sign of dehydration. Low fiber is also another reason for constipation. So I don't know if everything's connected, but I would say make sure high fluids, high fiber for the constipation. Look when she's having the abdominal pain and nausea and what type of food, and talk to the provider so they can do the appropriate workup. Next one was, I didn't know where my daughter's sickle cell started. She was diagnosed at 2, now 56. Both her grandmothers were tested and had no trait. I didn't know where my mother got the trait. Today, I believe it was my grandmother because she had gallstones. Where can I get this information? This is hard to answer because at the end of the day, your genetics don't change. So it's somebody, you need 2 people with sickle cell trait in order to have a 25% chance of having a child with sickle cell disease. So your daughter has sickle cell. That means that both parents, both parents, mom and dad, both had to have sickle cell trait. And if we're going to the other generations, somebody had to have trait. It could be the grandfather, but it's hard, especially if they're no longer living. But you would test them by doing a hemoglobin electrophoresis. When you do a sickle cell screen, it's only checking for hemoglobin S. So if you have, say, hemoglobin AC, that's not sickle cell trait, but a person with hemoglobin AC could have a child with hemoglobin AS, sickle cell trait, and have a 25% chance of having a child with hemoglobin SC genotype. So when it comes to family planning, just doing a sickle cell screen alone isn't enough. You need to do a hemoglobin electrophoresis, which gives you a breakdown of the type of hemoglobin you produce, plus a CBC, because if you have a low MCV or a small red cell size, that could be a sign of thalassemia. And we know that sickle cell trait and thalassemia trait can then combine to create sickle cell thalassemia genotype. So I would say hemoglobin electrophoresis will be, but both parents and grandmothers had the trait. I had the trait, so yeah, so that makes sense then. If anytime you just need 2 people with trait to create sickle cell disease. And it's kind of harder to backtrack, but it sounds like based on the genetics, if you had those 2 with trait, that's where your daughter had gotten it from. PJ had asked, what are the risks for periods in young girls and women due to blood loss? As this addresses the pain can really intense during these times. I will always ask my females, do you notice more pain around your periods? Because we know that from the blood loss or even from the hormonal shifts, yes, you can get sickle cell crises associated with your cycle. And if this is the case, I always send to gynecology because, hey, we have something we can address. Let's put you on contraceptives. And when you want to go on contraceptives, we're not doing this for birth control. We're doing this to control your period. Like I had one patient I had sent to GYN and the gynecologist, and she was a lesbian. And the gynecologist is like, why is your provider sending you to me? Like, you don't need birth control.
Wow.
And she was able to advocate for herself and just say, you know, I always get sickle cell crises when I have my periods. And my provider said, if I can control my periods, that's potentially 12 less crises a year. So if you notice you are having really bad crises, it's not just a bad period, definitely talk to your provider. The key for contraceptives is you want to avoid estrogen because having sickle cell increases your risk for developing blood clots. Estrogen increases your risk for blood clots. So knowing that association, I always recommend progesterone only. So that leaves the progesterone only pills, which I don't like because you have to take it at the same time every single day in order for the maximum efficacy. Otherwise, you have a lot of breakthrough bleeding, which we're putting this on to prevent bleeding. I don't want more bleeding. There's the Depo-Provera, which is an intramuscular shot, or you can get it in your butt every 3 months, which is a great option for your adolescents and young adults, but it's not something you want to be on long-term, like 10, 15 years, because it actually can weaken your bone and might lead to avascular necrosis. So short-term, that's a good option, but definitely not long-term. My personal favorite are the IUDs, or the intrauterine devices that you can put in and forget about it for 5+ years. As soon as it's removed, your fertility is restored. So if you want to have kids, it's restored. You're still able to after that. And this person said the gallstones were confirmed through ultrasound. So yeah, I would just check and see when if the abdominal pain is happening with that and the nausea, especially around the fatty and greasy meals, I would just confirm that nothing's changed. And if it's a common trend, then it's reasonable to consider surgical removal. And nowadays the surgical removal is it's laparoscopic. So they essentially, it's usually 3 different incisions that they're able to use a robot. So there's not significant scarring compared to 20 years ago. We'll have patients that have a very nice incision. And those are all the questions in the chat so far.
Fantastic. Carla, it's on you.
Thank you so much. I want to say I saw one question. Wait, hold on a second. Sorry, not
Oh, I
missing
saw
it.
the one with acupuncture.
Yes.
Love that. So I'd encourage patients to check with your benefits and see what's covered, because I've been able to get acupuncture covered. I've been able to get a massage therapist covered for patients. I am all about anything besides narcotics. Like, yes, if you need narcotics, use your narcotics, but I always say use the lowest effective dose, because we know that you can develop tolerance. So that means the longer you're consistently taking a narcotic, it's just a matter of time that your body gets used to that dosage and we have to increase it. That's what tolerance is. Your body can also develop dependence, where it's when I say dependence, there's a difference between a physical dependence, which is when you develop withdrawal symptoms when you're not taking the narcotics, versus a psychological dependence, which is a substance use disorder and addiction. Patients with sickle cell, like, you have a physical dependence, you need narcotics, you have a condition that is characterized by this. But if you notice that when you're not taking your narcotics, you're then getting the withdrawal symptoms, which I sometimes describe as a really bad cold. You might have runny nose, runny eyes, you're sweating, you're restless, you have the restless legs and just feel really crummy. Those are sometimes, and you sometimes can get pain with it too. And patients take their pain medicine and it makes them feel better. But the problem is that's fueling the rate of more tolerance and dependence. So I think incorporating other strategies for pain management is so important. I did acupuncture and I loved it. I don't think acupuncture helps for people who don't believe in it. Like my husband, it would never work for, but I think for people who are open and interested in that type of stuff, totally. I think acupuncture, massage therapy, one device that I use is called a TENS unit, trans electrical nerve stimulation. You can get it on Amazon I just saw it yesterday because I was showing it to a patient on that lightning deal for $29.99. You do not need the 100+ medical grade ones, but this provides just different nerve impulses to help with pain relief. You can use it anywhere on your body except your heart and chest because it does affect nerve conduction. But for me, when I get my back pain and I start using my TENS unit right away, my flare-up only lasts a few days instead of a couple weeks. So I think that's something to consider. The hot baths, heating pads, and different pharma strategies, like even CBD cream. Some people have medical cards. I think when it comes to medical marijuana, there's definitely a utility for it. I just think you have to be mindful that anytime you're smoking, there's a possibility of triggering crises, and just long-term smoking can cause different types of lung issues. But opioids are going to cause issues too. So it's kind of figuring out the risks and benefits and what works for you. And if you are going the medical marijuana route, sickle cell is a qualifying diagnosis in Florida. And I think at the end of the day, if you get pulled over and a cop racially profiles you, I'd much rather you have it legally than something happen from that standpoint. So sometimes opt for edibles and topicals. And if you do want to smoke, I would say just avoid the rolling papers and things which are even more damaging and potential to cause that irritation and crises. Somebody had asked, how did you get massage therapy paid through insurance? And it wasn't Medicaid insurance. There was Molina Medicaid. I was shocked. So call the back of your insurance and you can call the customer service number and just ask what type of adjunctive therapies are covered. And you can ask, is acupuncture covered? Is physical therapy covered? Is massage therapy covered? And if so, then you have to just find a massage place that's in network, and the customer service line can very well help you too. When they say, yes, it's a covered benefit, you can say, oh, do you know of any places near me that accept the insurance? And they can email you a list of places that are accepted. So it takes a little bit of work, but if it is covered, I totally take advantage. I wish my insurance covered massage therapy. Somebody asked, what do you think about Suboxone for chronic pain? I don't have personal use with it yet, but we're really trying. It takes a process, because I heard an amazing case study, and ever since this one, I'm like very eager to try one of our patients on it. For this individual, he was on oxycodone 240 milligrams extended release twice a day, in addition to Dilaudid 16 milligrams as needed for breakthrough pain, which is super, super high doses. And they were able to transition him onto Suboxone, and he's not even using anything for breakthrough pain. So I think there really is utility for it. When it comes to using Suboxone, there's a withdrawal period. You have to withdraw from the current narcotic you're on before starting it. So we're currently trying to figure out a way to bring a patient to admit them, so I can do it under medical observation, so we can give IV fluids, give medication for the nausea if they're having restless legs or anxiety, et cetera. So we can just control it more, because detoxing from narcotics from the general population versus a sickle cell patient is very different, because the withdrawal symptoms can then trigger sickle cell pain. So I think it's something that needs a little bit more hands-on. And I think it seems like it's very beneficial. I just don't have personal experience just yet to speak more. Meisha asked, is it called a TENS unit? It's like the number 10, TENS, no D. And it stands for trans electrical nerve stimulation. Somebody asked, what can be done to dispel the myth about sickle cell being drug seekers? And I think it's just, we got to keep shouting it out, spreading awareness, educating. It's just very frustrating, because like last week, for example, I had somebody in the emergency room who we found faked having sickle cell. And you might be like, how do you fake having sickle cell? But there are patients who have very compelling stories, and they even say like, oh, Dr. Harrington's my doctor. They'll name a sickle cell provider that's well known in the community and have these stories. And it almost creates an environment where providers want to like find those people who are faking sickle cell, when in reality, it's such a small number. But it's so unfortunate, because those individuals who are doing it are making it harder for the warriors who truly need pain medication. So I think we just need to continue to spread awareness. And we like having medical students and residents rounding with us, because when you're seeing a patient inside the hospital, that is when they're at their worst. And I think introducing patients to sickle cell warriors just during routine follow-up visits and when they're at their best, and just showing their people like you and me and just humanizing what sickle cell looks like is very empowering. But I think at the end of the day, it boils down to a provider's implicit bias, and it requires a lot of self-reflection to notice and have the awareness that you're doing it. And unless somebody has that emotional maturity to do so, I don't think that generation is going to change. So I'm hoping with the next wave of doctors and healthcare providers, we continue to dispel that myth and bring better care to our patients. Somebody said, my 15-year-old takes Suboxone. Finding the right dose is super hard. You have to trust the process. Withdrawal from methadone was hard. The last part was done inpatient. Thanks for sharing that. Yeah, Ebony, it's terrible. We have a whole list of, like a long list of fake sickle cell patients, and they're out. They have different names that they go by, and it's shared across all of the emergency rooms in Florida. And it's very frustrating. It's like when you find one, it's very frustrating when it's confirmed that they're faking it, because why would anybody fake? And it's just, it makes the narrative of what sickle cell warriors have to go through much worse.
Well, and substance use disorder, I think, you're not the best version of yourself, right? And you don't take things into consideration of how it's impacting other people. So, I think that as we continue to do have more conversations about the harms of misrepresenting yourself as a sickle cell patient, hopefully that message, gets to those in the community, who might see that as a way to get their narcotics. So. I also think, if I might add to the question that PJ asked, about the stigma, I think part of that stigma too is just understanding that we are more than our sickle cell. And in being more than our sickle cell, we don't want to be defined by that. So I actually also think that the word sickler really carries a great stigma. I actually just completed a sickle cell nursing boot camp in Memphis, Tennessee this last week. And one of the conversations with the nurses was, how often the word sickler is used in negative context when providers are describing their patients, and how much that really impacts the care that they get. So I think that, we all have to make sure that we're creating a narrative in the words that we use and how we talk about our experiences that help people to understand us in a holistic sense, more than just our vulnerabilities, but also our strengths.
Agree.
Thank you so much for sharing that, Ray. And thank you so much, nurse practitioner extraordinaire, Maya Bloomberg. If you have not followed her Instagram, TikTok, please do. Her information is so informative, very clear to understand, and it provides so much education. I am so thrilled that she's here at the Empowered Caregivers Forum, and she has been at our sickle cell and chronic pain management symposium also, and we have done other things together. So I'm so glad to have you as a partner and a great provider in our community, definitely leading providers, one of the leading providers in Florida. So thank you so much for your dedication of education for sickle cell and the hemoglobin community on a whole. Thank you so much.
Thank you guys for having me and putting on such a great program to just empower caregivers and warriors to just take charge of their health. My DMs are always open, so if anybody ever has any questions or topic requests or things you want to learn more on, feel free to send me a message, because at the end of the day, I want to put out information that is most beneficial to you. So thank you all for listening. I hope it was informative, and enjoy the rest of your presentations later. Thanks,
Thank you. Thank you.
Thanks, Maya. I'm excited about this next section. Go ahead, Carla.
Yes. So I would like to just thank everyone for coming to the Empowered Caregivers. If this is your first time at the Empowered Caregivers, please put it in the chat. This is family here. So here we talk, we have presentations, we like input. We have a roundtable discussion at the end. So our Empowered Caregivers is for our family of fear, caregivers, those with interest, and also warriors. So we know how important it is for everyone to come together as a community to learn, network, and definitely gain some information on resources. So I wanted to share a little bit about myself. I am Carla Lewis, founder of Kids Conquering Sickle Cell. I introduced myself in the beginning. I have a child with sickle cell disease. He is now 20 years old. His birthday was last week, Friday. And last month, he received a bone marrow transplant, and our match was his brother. So I wanted to just go down. I know some of you may follow me on social media, and you first heard, okay, Carla's son is going to have a bone marrow transplant. Then I provided an update. So I just wanted to share a little bit about our steps. So it was so important for me to not only educate myself about curative therapies, but also make sure I educate my son. So when I decided that going through this journey of learning about curative therapies, it was mentioned to me by his physician about just exploring options when he was about 12 and sickle cell came more aggressive. Prior to that, he really didn't have much complications with pain crisis or anything with sickle cell, very minor. But when he was 12, it got more aggressive. Then treatments, actually new treatments available, was actually able to help him. So what are those treatments? Like Maya mentioned hydroxyurea, which he was on. We also went on eventually on Indari and also Oxbryta, which also helped to control many of the crisis hospitalizations that was caused. And literally the hospitalization minimized to maybe once a year, then twice a year. Sometimes he had years that he had no hospitalizations at all. And I mean, no crisis, not even managing crisis at home. So we decided that just learning more about curative therapy education was so important for me to actually sit my son down and give him more information about curative therapy, letting him sitting on sessions, educational sessions, whether I saw platforms as conferences virtually. Of course, social media opened up a new world, and COVID opened up a new world of getting information via the internet. But we sat in our educational conference because I wanted him to have the right content information. So sickle cell educational conferences we sat in on. And we also had a meeting with his doctor. It was important for me to further discuss this with his doctor, to let his doctor explain to him. So it's not only coming from myself, it's not only coming from others. And so his hematologist kind of explained the options. And then I also contacted Be the Match to get their resources, and also being able for them to send us a packet of information for him to learn about bone marrow transplant, and also he was learning about gene therapy. So I looked for resources in both avenues to learn about curative therapies for him, and he was able to discuss this with his doctor. So one of the great things also was that we had a great doctor that told him, that was very informative, and told him that, this is up to him. He can make his decision on what may best fit him. But of course, there's more information to find out. So I decided that all of my entire family, household, that is only, so our household would get the HLA testing in order to learn more about our antigen to see who's a match. And it just was a blessing that my 11-year-old son, he's now 12, today's his birthday. So they have back-to-back birthdays. My 11-year-old son was his 100% match. So this information was so exciting to my family. And who sent out the package in order for him to see who was a match was the referring team that the doctor referred out to. So for our case, it was the hospital, the bone marrow transplant hospital that sent out the HLA testing in order to see, and that was Johns Hopkins Hospital. So, so after we learned that Sheldon was his match, we scheduled a time that we can meet with the bone marrow transplant team. They was able to provide, you know, educational information, not only to Shamar, but also to Sheldon, because Sheldon had to learn the process. Well, I have a unique, son, Sheldon. That's him in the corner with his dog, which he loves. So I have a unique son that not only gravitates to information, he is very, very smart at researching information. So we went in and we realized that the team was great at explaining the information, but had a lack of information for Sheldon to understand the whole process. Well, Sheldon looked up information on YouTube and actually saw a video of the whole process that he wanted details of what he would be going through and what it looks like. So he actually found the video and actually then told me to go watch the video, and we went through it together thereafter. But learning from the BMT team was very, very important. And one of the things that I have to call out to us when we had to understand also is that this process is very, you know, it takes time to think about it. It does so it was no rush. It also, we came in with questions. So we had a list of questions, myself as a caregiver. Shamar had his list of questions. One was fertility preservation support. We wanted to know what was the support there. That was very important because we know the impact of chemotherapy and damage to, you know, the ability to, you know, have children. So fertility preservation was a very, very, very vital question for us to ask about that resource. And there are resources out there. So now we, blessed by the Reproductive Sickle Cell organization, which is Tiana leading that. So if you ever know Tiana, that's in the advocate extraordinaire in the community. That's her organization provides a grant through Be the Match. So in order for fertility preservation, that was never available for a sickle cell community. They far and few between you can find places. And actually our treatment center for the BMT actually had another kind of grant, therefore, that they had a minor grant that was helping patients out there. Also, so going in with questions was so important. Another thing for us was prayer and faith. I have to say that prayer and faith is key to everything that we go through. Particularly, it was also very, very important for this journey of my family. And I encourage anyone that goes through this process, if you have a leader of faith, just know that you will be tapping into prayer. For us, it was so important to lean on prayer and faith. We hear a lot of things about, you know, going through curative therapy, if it's going to works for some, may not work for others, what the complications may go through it all. But when you have faith to believe this is going to come out great, and putting, you know, for us, we put it all on God. So all we wanted to do was follow along. So prayer and faith was so important for my family. And part of this session, actually, when I thought about our sickle cell community and the title of this session tying into sickle cell management, mind, body, and spiritual wellness. Part of our spiritual wellness, even beyond going through a bone marrow transplant, there is something that you have to stay connected to in order to go day by day to fight this illness. Prior to my son managing sickle cell, managing this bone marrow transplant, we had times that he would have crisis and be in the hospital, and I leaned on my faith, I leaned on the prayers, and I have to say I leaned on my support system of advocacy friends that became family. They're not even friends no more, they're family. So Ray, she knows that she is my buddy, my sister. You know, I have my Ebony, which is here now, and also Pat Corley, which is also in the community, and so many others that I really have gathered as my support family. Dr. Simone, all my support family. I can tell you, it means so much. So going through this particular journey time, I allowed my son time to process information. So even though we went in for a meeting, it took him probably like almost 11 months for him to make a decision. We didn't rush him. We knew that this is something he had to process. He's a young adult. He would be making a life-changing decision because he was also working and just been active, right? So he had already finished college. High school, and was in college. And that would mean he always had to take a break from school. There was things impacting. He was working part-time. He loved spending time with his friends. There was a lot that he had to also process. And what did treatment mean for him? You know, he also had to sign important papers, letting him understand the pros and the cons, letting him learn about graft versus host disease. They did not cookie cut anything, and other complications that could possibly go, wrong. And also the positive side of it. What would life be like living sickle cell free? So there was a lot for him to also process. So time was also something that we allowed my son to process, knowing that he needed to also speak with other warriors that had gone through the process and what was best for him. We looked into gene therapy also, but this is the option that he chose, just saw better results for him to, be successful. And eventually when he made that decision, we tapped into our support system. He had a support system of siblings. So he tapped into talking to his siblings when he made the decision. I wasn't even invited to that session with his doctor. He actually called his doctor and had the meeting, and then told me after that, oh, I just spoke to him and told him that, yeah, I'm going through. So my feelings were hurt because I'm going through this transition stage. You got to know. And I was like, well, I wasn't invited to the meeting. I mean, I set up the meeting. I was ready the day and everything. I was like, knocked on the door, like, "Reading about to happen." He was like, I got this. I don't need you in this meeting right now. And I didn't know what the meeting was going to be about, right? So I wanted to know. So when he came after and told me the meeting, I was like, Dad, I wasn't invited to the meeting. But this is part of what we want to see in them: the independence, the growth, them to be able to ask questions, making that independent decisions on, and being able to literally tap into that adult responsibility that we have instilled into them as these young adults. So I was actually proud of him on another hand to also make a decision to speak privately with his doctor, even though I was losing my feelings a little bit. But I really appreciated to see the growth that now he was taking the lead. So we tapped into letting him know that we support his system, and we support his decision, and we tapped into our support system in order to provide, the extra support that's needed, and told him, that we're going to be there with them. And then going through the process, having to make sure that he had what he needed in order to go through the process, talking to him about things about, having to disconnect from school at this time was definitely necessary. Being able to manage that, and just telling him how important, it is for him to continue the communication with his friends, and just, try to live that normal life as possible, even through this process. And I have to go into this particular verse that I have here. For I know the plans I have for you, declares the Lord, plans for you to prosper and not harm you, plans to give you hope and a future. This is the scripture we stood on through the whole process in order to help us daily, because even as a parent, I knew there would be difficult times for me to watch my son go through being ill, even through this particular time. But interesting enough, the times that I saw him, what I expected was not what what was exhibited to me. So I could say I saw him more sick, having a sickle cell crisis, than I saw him sick on chemo. He didn't have any complications to that with chemo. He did have a allergic reaction to another medication that was a part of the treatment, but not really to the days of having chemo. So I would say that my harsh reality was still a little bit different, because he was in more, I say, crucial pain and agony, and seeing him down and everything else, fighting a crisis, than going to a treatment of going through this process of bone marrow transplant. There was days that, I mean, literally he was like, well, I'm not, I feel yucky, I feel awful when, chemo started. And that probably lasted 2 days, 3 days, nausea, vomiting. And after they had medications for that. So after finding the right medications in order to explore what works best for him, he was able to have that under control. He ate, appetite was a little different. That was more difficult, of course, when you have nausea. But they tried to do a feeding tube. That didn't work, so they gave him nourishment through IV. That was helpful, and he was persistent to say, I'm going to be trying to eat. Like, I'm going to still try to eat like as much as possible. So he chose his things. So he would eat applesauce, he would eat something, but they were very surprised that he drank so much water. Like, he made sure hydrate. And that was part of his regimen from sickle cell. So that actually helped in this treatment process, that he drank so much, like I think it was 2 gallons of water for the day. They was like, man, he was drinking like water, like gulping it down, and like we couldn't keep enough water for him. So they was like overly surprised that so much water he was drinking. So definitely tapping into just the normal things that we saw was actually helpful. The healing process. So it is now day 36 for him post-transplant. So he got the bone marrow transplant on March 17th. And so we were happy that, the process went pretty smoothly. And he was actually even able to go be discharged earlier than they expected. And he's doing pretty well right now. His hemoglobin is actually at 12. He's producing his brother's cells very well. They see great progress. Of course, he's on rejection meds and some other meds in order to protect his organs. He's on some medications also to help prevent graft versus host disease. So there's things to be proactive that they put in place also in order to have preventive care meds on deck for him. And he started a lot of these meds way before the transplant. So it's not like when you get the transplant, you're on them. No, they started a lot of these meds like the week before the actual transplant in order to make sure, help his body actually prepare for a lot of this also. So the process has actually been more positive than I expected. So I'm thankful. So I just wanted to give a little update about my family. Sheldon is actually doing well. He had the roughest ride, I can say, being the donor. His healing took a lot of time, but he's back active. He's a very active boy. So he's back very active and positive and feels great about being a donor. And actually, Sheldon had to make that decision. We left that up to Sheldon to make the decision if he wanted to be a donor, and educated him too. So we made sure he was involved and made sure that he had the necessary support too, on knowing what the process involved, knowing that we also support him on if he did or if he did not want to be a donor. So we're glad that Sheldon's also our hero in this. So thank you. I am going to see if anyone has any questions. I don't think I can see questions. Ray, can you see questions?
I do see one question from Tabitha. And we had a little slight conversation, but do you have to be referred for BMT or curative therapy, or can you request that you be considered? I saw someone post in a Facebook group that they were either denied a request for consideration or BMT, or a referral for a BMT. Now you can add to my response. I just said, always discuss it with your doctor. There are criteria that he or she will review with you. Anything to add to that?
Yes, Ray, you are certainly right. There is definitely, they will review your health history. That is definitely important. Your doctor, your hematologist is one that will do a referral. One of the things with us, they wanted to know prior to even coming in, of course, if there was a match in the family, right? So that was important for the team to know prior. Also, understanding the whole process is great that your hematologist can actually explain to you. There are a lot of studies. So when we think about curative therapies, we know that there's gene therapy that's available also. So it may not work for you for BMT. We know gene therapy definitely have trials out that you can probably be able to activate. And we also know that right now that in the near future, gene therapy is about to actually be FDA approved. So that's going to be coming soon. So the trials are actually available now. And for us, this particular for Shamar, when we looked at gene therapy also, the process was going to be a little bit different. But one of the trials that were available said that if you did have a match for bone marrow transplant, then he couldn't do the gene therapy. So that was particularly at this facility. So there's other options available if you're not able to meet the requirements. And understand they do look for different, I guess I want to say different, they have different places may have different criterias. So you may want to also explore that. I've heard that for people that have never had a bone crisis, also having a bone marrow transplant, some will say you have to have a crisis at least 3 times a year, 2 times a year in order for you to qualify, and they'll look at your history. So every place may be different also in the criteria. So you have to do your due diligence and just reach out. It doesn't hurt to ask a question when you hear about a facility that does a bone marrow transplant, and understand that what the dedication may take, because there's traveling. For us, definitely, we didn't go with a facility that's close to our home. We travel very far in order for him to get his ongoing outpatient treatment. But when he also for the curative therapy of bone marrow transplant. So that's another commitment. We have to stay out there in order to be able for him to get the necessary. That first 100 days is very important. So we have to be out there. So I'm glad I got to come home this weekend. But yes, it's so important. So definitely explore. Any more questions, Freddie? Oh, you're on mute.
Thank you. You'd think we'd know that all by now. Ebony said, and I so agree, I love that you allowed your son to take the opportunity to take his time and make an informed decision. I think we do a disservice by rushing into things simply because it's suggested. And you are absolutely right, Ebony. I think that is across the board with our health, particularly as Black and Brown people who have had quite the history in our interactions with the healthcare system. And you used a key word, informed decision-making, yes. Not emotional decision-making, but informed decision-making. So Carla, anything to add? And then there's one more question.
Okay, thank you, Ebony. Yes, and one thing that was very important to me, I had him speak to warriors that been through a gene therapy as well as bone marrow transplant. Particularly, I wanted people close to his age too, so he knows about his options and their experience from both ends. So I actually connected through Be the Match for some people by bone marrow transplant. And also from the work I do in the community, having those connections, I was able to connect with some warriors. And also for gene therapy, I found those individuals on my own and let him speak with them. So different. I wanted him to know that there's two different options available. So not because Sheldon was his match, he needs to know that he had options. And we would look into those options even further, whatever he decided. So definitely that was so important, and making him definitely take the time to process the information, because I know it was a lot. It was so much information. Literally that day, I think we all went home like our heads were all hurting. I know I had a headache. And then I have to say this, the step process, you will go, everyone's might be different, but I went through a lot of emotions, not only learning that he had a match, and this was like emotions that not good, and just undecisive about my feelings, like, what is it that I'm feeling? Why am I feeling sad this day? Why am I feeling happy this day? What is the process of this? What does this mean? I had to keep it real with myself. There was times that I didn't want to talk. I stayed in prayer and I said, God, please help me, give me strength through these emotions, because my emotions were going like waves. And those emotions continued. It continued through the bone marrow transplant procedure. It continued through the time of even after. Now I was able to cry happy tears going through that process of seeing him, now producing Sheldon cells. But those feelings are real. There's time that I took and I separated myself from the internet. I separated myself from social media. I separated myself and laid in my bed and stayed in prayer a lot of times when I was going through my emotions, because I knew I needed time with God. So I know that prayer and faith, you got to stand on your ground when you're even going through this journey. When I'm telling you that that emotional wellness and balance is so important. It really is. So and then seeing my son actually not feeling his best on those days, he was actually hospitalized prior to actually going in on unexpected hospitalizations due to fever, and then we found out some other things. But he stayed maintained healthy, and once they realized that when the medication and prior medication probably causing a fever and other things, then but seeing his emotion, because he hates being hospitalized, he hates going through. But one thing he said to me, I'm not in pain. And that just meant the world to me. He's like, I'm hospitalized, but I'm not in pain. And that made a difference for him. And even when he's went through this process and he goes in for his treatments, he's actually monitoring, then seeing him and able to ask questions and tell them his feelings and be able to, talk to his team is very important. I know we're into our break time.
So one last question. We'll take this. We'll address this one last thing. So let's see. During a live Sickle Cell 101 Q&A with Dr. Q, he mentioned that some patients who receive BMT have still experienced pain after the transplant, though rarely. But was this something that you were counseled about, or did you and your son have this discussion? And after you answer this, I'd like to make a comment as well.
Okay, so yes, they did explain to us about pain. One of the things that damage doesn't go away, right? So the prior damage that occurred, my son always had like he had chronic pain in his back. So that chronic back pain that was constant, that's what he had. Right now, he says that, he got so used to it, it became so common that if he doesn't talk about it, he don't recognize it, right? So that pain it's probably still there, but at times it's not what he focuses on, so he's able to go through. So we have to remember that the damage that has already been done, this curative therapy does not heal that. That will, those things will happen. And currently, as far as having spouts of pain, he has none. So everyone is different in this walk, but we do understand that there's acute pain and then there's ongoing chronic pain. And those two are two different types of pain and could still be treated, right? It could still be treated in different ways. And so right now he doesn't experience no acute pain. He may have some chronic pain and feel that, but his mind is not concentrated on that. there's no acute pain, which was the devastating thing to him, to be hospitalized because it could no longer be controlled at home. That had to always be he always had to be hospitalized for that acute pain. So thank you, Ray, to ask that question. And if you have anything to add, Ray, we welcome, your
I think you answered it beautifully. Really, it's the difference between that acute and chronic pain. Keep in mind that chronic pain is a result of nerve damage, of those nerves constantly being stimulated around the sickle cell disease. And anytime you have nerve damage, whether you have sickle cell disease or not, that is oftentimes extremely long-term. Nerve repair takes years upon years upon years. And so they're still studying that and watching that in many patients who have undergone bone marrow transplant. And other curative therapies that are coming down the pipeline will be need to be addressing that as well. So those are the things that the more you know, the more you can talk to your doctor about and ask those questions. So I love it. You guys are really engaged in the conversation, and these are such important conversations to have.
Thank you so much. I want to take the time because we have, I know we have overdone our time with the break. But if you need to, move around, get up, feel free to stretch. Ray, we're going to go to a trivia question. If you have any questions for me, you can always feel free to email me at the end. My information is at the end. But we will go to a trivia question. We missed break, so just know that we don't have no time for break, but we thank you for chiming in because this information is important, right? We know it's that important. So we thank you for, understanding.
Okay, trivia question number 3, drum roll, please. Name 2 current curative therapies for sickle cell disease. Oh, we heard some today from Maya.
Okay.
Name 2 current curative therapies for sickle cell disease.
Come on, type it in the chat. The first one to get it. Let's get it.
And then Carla, you'll want to check the chat box as well. There's a message to you.
Oh, I can't even see it because I have this up. So hold on.
All right, I don't see anybody answering. Name 2 current curative therapies. We were just talking about one of them. Excellent, Tabitha.
Come on, you have to have 2 to get that prize. Type in 2 at the same time.
Looks like Tabitha was first with gene therapy and bone marrow transplant. Absolutely. Bone marrow transplant, you need a match, as it says. It's also called stem cell transplant. A lot of people get confused over that. It's BMT or stem cell because they are extracting the stem cells from your bone marrow. So they are the same thing, though. And then, of course, gene therapy, which is still in clinical trials, but is getting closer and closer to becoming launched and available to the general public. Bone marrow transplant or stem cell transplant, you need a donor. And gene therapy, you do not. That is gene editing. So gene addition or gene deletion. Excellent job. Excellent job. Okay, so we're going to keep it moving to our next section. And we are going into, Carla, did you see the message?
Oh, I can't even, can't access. So if you can text me.
Yep. It's from Shana.
Okay.
And so you're going to want to use the presentation that she sent you.
Okay.
Hey everyone, I just wanted to, I am having a really bad connection. So I did a plan B. I did a pre-recorded one also, if you're able to pull it up in your email.
Okay, just give me a minute.
Well, and while you are doing that, if I can find, we put so many windows up that you got to find what you're looking for behind some other windows, because I want to make sure that everybody knows how fabulous you are.
Yes.
So I am bringing it up. All right. So while you're getting that together, Carla, I want to talk a little bit about Miss Shana Andrews. She is the founder and CEO of Girl Listen Enterprises and the social service director and co-owner of Andrews Counseling and Family Resource Center. She is originally from Yazoo City, Mississippi, and attended Mississippi Valley State University, where she earned a Bachelor of Science work degree while still in the process of completing her master's degree in social work. Mrs. Andrews has over 15 years of experience working in the social services field, but will also join her husband in providing mental health services in the near future. Mrs. Andrews is passionate about working with women who also want to achieve their goals and need additional resources or assistance with their journey. Mrs. Andrews believes that empowering and educating other women on self-care and strengthening the family unit are important in order to strengthen the communities we all live in. Yes, girl, listen. Mrs. Andrews is also well known for her first nonprofit organization, Serenity Women's Circle, in which she founded in 2009 in her early 20s. The creation of Girl Listen podcast and the Girl Listen Conference. She is a chapter leader for the Yahoo City chapter of the Mississippi Writers Guild, elected as the membership chairperson for the Mississippi Valley State University Metro Atlanta chapter, and a dedicated advocate for sickle cell awareness, education, and children and foster care. That's that Black girl magic all up in here. So I am so thrilled, and we are bringing her presentation, which is on preparing with a peace of mind, advanced care planning. Carla, go ahead.
Thank you. Well, we have our fabulous Miss Shana Andrews. Thank you so much for being here and providing this great information for us, because this is so important. And I want to input that advanced care planning was a part of my process also, prior even to this, to talk to my son about this and have a plan in place. So this was so important to include in this session. So thank you for being here. Shana, do I have to do anything else?
Thank
Just
you
tell me
so
what-
much.
Okay.
If you have, do you have the recording up, or is this the slideshow?
This is the slideshow.
Okay, I'm going to try to share my screen, but I also emailed you the pre-recorded one.
Okay.
Let me see. I can, but I don't know how long my connection is going to be. That's the only thing.
Okay. Let me see. So you gave me two.
Thank you for your patience, everyone. That's what
Thank
we
you.
love about doing it live. We just flow with it all and we make it work. And so thank you again. If you'd like to grab some water, take a bathroom break, anything like that, feel free to do so.
Yes, yes, yes. Mm. Okay, right now I can only pull up the slide, Shana.
Okay, I'll go ahead and share my screen and see, and hopefully it makes it all the way through without me disconnecting.
Okay.
All right, just.
Are you able to share?
Yes, I think so.
Okay.
Let me see. Just a second.
Okay, I'm just seeing the.
Okay, am I sharing it correctly? Let's get a plan.
I
Yes,
can see it.
I can see it.
Well, disregard the email in the back. I won't know how to do, let's see if this will do full screen, I'm not sure. Greetings. This presentation is regarding preparing with a peace of mind, advanced.
The sound went out, Miss Shana.
I can be reached at Shana at andrewscounselingfrc.com. And I can also be found on our website, andrewscounselingfrc.com, or you can contact me by phone at 678-812-9020. So when I think of peace of mind, I think of this quote. It says, "It does not mean to be in a place where there is no noise, trouble, or hard work. It means to be in the midst of those things and still be calm in your heart." So what may cause stress or just not being able to get into a good peace of mind or feeling peaceful or feeling a calmness? Well, the stress factors. There could be medical bills, your overall well-being, medication, your future, employment, your social life, education, children, time, and even family. And there are so many more factors that, aren't mentioned here, but I'm sure we've all had many things going on at the same time, and it can get a bit, it can cause a lot of chaos. So we're going to get into a few tips that I found helpful with not only being a caregiver, but with just being a parent and navigating those day-to-day activities. We're going to start with preparation for children living with sickle cell. This is from a caregiver's perspective. So here are the tips. Prepare teachers and daycare staff. Preparing teachers and daycare staff will you can equip staff with a medication log. You can make them aware of symptoms or signs to look out for, any emergency contact info, etc. You want to make sure that they have all the information needed about your child so that in emergency situations, they know exactly what to do. Also, you can form partnerships. You can form these partnerships in the community by joining sickle cell organizations, medical boards, support groups, and advocacy groups, and even state legislature. This is helpful in terms of support. There is power in numbers. The more, the better. This can bring a peace of mind knowing that there are others in the community that know your story, that know your child's story, that you can easily reach out to for advice or support. So it's very important to establish partnerships in your community. Establishing a morning and night routine. This is one of my favorites because I am a stickler for routines. I have to have a routine or my day feels very thrown off. So establishing a morning and night routine is helpful when navigating your daily task. It provides a peace of mind knowing you and your child can prepare and take control of your day. With the routine, goals can be achieved daily with a routine. So achieving your goals within that day and knowing that you will stay on track to your routine as much as possible can definitely calm you and prepare you. Even if you get off track a little bit, okay, at this certain time, this is what we need to be doing. And it is so helpful to have that. Establish your village. This is similar to building partnerships in your community. When establishing your village, you find supportive friends, family, babysitter, or whomever you have a trusting relationship with that can help you juggle parenthood and your caregiver duties. It's okay to take a break so that you don't take a break so that you don't lose yourself within all the things you're responsible for.
All right, folks, that's okay. It looks like we may have lost her momentarily, and I'll bet she'll come back on. But isn't that information good? Just finding the little things that we can do to really bring our stress levels down, to feel more prepared, and to feel like the people who are in our children's life are better prepared to care for them the same ways that we would, or at least very close. They're not the mama, right? But, you know, knowledge is power. And so helping people to become more informed about your children and about their health condition is going to really, as mothers, help us to feel a bit more comfortable. As we wait for her to return, Carla, how would you like to proceed? We could.
Yes, I am bringing it up. So I will bring up, I just found it. So I will bring it up. I'm working on that. Thank you.
No problem. Thank you all for being superstars this morning. Technology can feel like both our friend and our enemy, but we make it work. So thank you. And for those who may not know, we will also have a caregiver panel coming up as well. So make sure you're staying tuned to it all, to all that we're offering. And Carla, did you check for the volume? Check the box for audio? And if you put it in the folder, I can pull it up as well if you'd like. So let's conversate, you all, while we are working on the technical issues. How are you all feeling about the content you've received thus far? Let's hear from you all. Hello, Renee. I see that you commented in the box, in the chat box.
Good morning. I'm joining late.
Absolutely, I understand. Would anyone like to introduce themselves? Tell us about yourself and the age of your children. Tiffany says the content is very helpful. Thank you for providing it to us. You know, when my son is 26 years old now, and in 1996, when he was diagnosed through newborn screening, he was 2 weeks old. The internet didn't look like it does now, y'all. It's had a green background, and there was no place that I could go online, not only to look for education and information, but even to connect with other individuals within the sickle cell community. So this is such a blessing to be able to bring the community together without, you know, regardless of what state you're in, there are no boundaries. So we have become from one state, we are now national, we're even international. And that is so important to the journey that we all take with sickle cell disease. It's also important to our warriors so that they don't feel isolated, so that they don't feel abandoned and alone. It's important for them to understand that they belong to this bigger, greater village, and that gives them purpose and helps them to feel like that they fit in, because it is tough. You know, it's not something that that everyone wants to talk about openly, and each person will manage their journey in the way that feels best for them and provides the healthiest coping strategies. But your village is your strength. And so connecting all of us with one another is so, so important. So I'm glad you're here. Tiffany says her daughter is 12 years old, living with sickle cell SS disease. That's awesome. That's awesome. And it sounds like she's had quite the journey already. And so it's so wonderful that she has you as a mom and caregivers and family. Keeping our kids connected, keeping them connected is really important. It's not unusual for them to want to pull away. You have your social butterflies out there. Don't get me wrong. There are the social butterflies, and I love it. And we are a combination of all kinds of personalities and strengths. And so connecting with one another allows us to see ourselves as bigger in a bigger context of our community. How's it going, Carla?
We're ready.
All right.
So I'm going to continue from here.
Wonderful.
It's okay to make mistakes. You're at the age to do so, but this is
Can you
just
guys
to help
hear?
you transition
Yes, we can.
to full adulthood. So number one, provide a medical journal to your teen or young adult, or just let them know a medical journal is similar to a personal journal. A medical journal, they can carry it with them everywhere, especially the emergency room when they find it hard to advocate for themselves because they're in pain for so long, or maybe, it's so painful, their crisis is so painful that they just don't feel like talking, which is very understandable. So a medical journal, it provides a space for names and contact information of doctors or nurses. It would list any prescribed medications, the frequency and location of the pain, name of the hospital, notes about staff or nurses and doctors in emergency room visits, keeping pain meds or other remedies readily available. Also, having those things readily available in your car when you're traveling or going to work, and absolutely doctor appointments, especially if you're changing doctors. So, a medical journal, again, is just keeping this very important information in a journal where they will keep with them at all times, or as many times as they feel needed. And along with that, a medical planner. A medical planner is you just get a blank planner or a planner that comes with a calendar. And I love this because my husband and I use it, and it just helps us keep up with doctor appointments, therapy appointments, or other appointments related to the overall well-being. Medication tracker and dates of symptoms or side effects. And we also keep instructions or contact info in case of emergencies in this planner. Some of our planners have goals that you can list in there for monthly, weekly. It's just amazing. And there are some really good planners on Amazon that you can find. It is very helpful, and you can even keep some of your information from your medical journal in your planner. Okay, and so in addition to that, learning about their own medical insurance and preventative care options, it's also good to help them with time management and creating a routine. Support groups for teens and young adults. I feel like you can start introducing them to support groups with their peers that also have sickle cell. This will give them a peace of mind, will give you a peace of mind. It is good for their social life. It is good to have someone in their corner that actually understands them. So support groups or mentors are very beneficial. Taking care of their mental health, attending therapy. Our teenagers and young adults go through a lot of emotions, a lot of stages in life, a lot of levels of, what they're feeling on a day-to-day basis. As you know, with teenagers, it can change. They can be one person one day and then another person the next day. So Therapy is something that should be seen in a positive light and introduced to teenagers and adults early on, and letting them know, hey, this is a positive thing. Not saying there's necessarily anything wrong with you, but it's good to talk to someone and get some skills on how to cope, or how to just, you know, navigate through the day-to-day challenges that you may have, and how to do so in a healthy way. So introduce your teen or young adult to therapy, please. As adults, we still don't have it all figured out, and we also need therapy. If not a therapy session, maybe an outlet that can be therapeutic, such as drawing, if they like to sing or dance. Find things that can be a therapeutic outlet for them. Okay, and the last thing, emergency room preparation. Make sure that you have somewhere where you can store an overnight bag, blanket, socks, pillow, phone, and charger. Anything for relaxation, list of medications, license, insurance cards, and also let others know you are at the emergency room. Very, very, very important. And you want to have these things on standby if you do have to go into the emergency room. I just feel like it helps with that peace of mind and that management of, um, having the sickle cell crisis, and just puts you more at ease than the chaos or the worry. I want to talk more about medical and personal journaling. I want to make sure that you know the benefits, because it is so helpful. I journal all the time. I try to encourage my husband to journal. And so, one of the things that are helpful for journaling is, and you can take notes at this time as well, it helps clarify complex issues. It brings solutions into your consciousness. It helps reduce some symptoms of depression. It helps you discover what you want. It can address problems in a less threatening manner. It helps with more thought on your life transitions. It can help you cope with interpersonal conflicts and problems. Some journaling questions or writing prompts for your journal can be, what did I do to take care of myself today? Again, what did I do to take care of myself today? Another one is, what can I do to improve my life? Again, what can I do to improve my life? And the third one I'd like to introduce is, today I feel or felt, and then fill in whatever that is. Today I feel or I felt. And be truthful when you use this writing prompt. Be truthful, knowing that this journal is for your authentic, your most honest answers. It's a reflection that you can use and go back to each and every time, and you can actually see your growth when journaling. When you go back a few weeks or a few months and you say, wow, I really have grown, I really come a long way. It really does help. This next slide goes into a little bit more detail about peace of mind and self-care and security. So, as a caregiver, it is good to, well, I would say a caregiver of a person that you're caring for that has sickle cell or any chronic disease, it is good to have life insurance plans and coverage. It is good to have a will created. And it is good to know their net worth, your net worth, and estate info and plan it. And all of these can be done with an attorney. This is good because it is going to give you peace of mind. It is a form of self-care and it is security. And we don't like to talk about these things because it deals with, you know, it deals with a hard situation, a hard topic of the what if of something happens to me. What if something happens to the person you're caring for? It is a responsible practice to have these things covered, to get a real understanding of these things so that you can have a peace of mind, so that you can be more in tune with your self-care and security for you and your family. The next thing is diet and exercise, stretching or yoga, and meditation, and sleep. Oh my goodness, sleep. If nothing else, sleep. It helps with clarity for your mind. It helps with your overall health. If you can't take care of yourself, how can you take care of anyone? So these things are important, even if some of us don't like to do it. I don't like to do it. I probably need to do a better job of doing it. Also, mental health counseling. Individuals, caregivers, couples, and families, however you choose to decide to get counseling and whomever you decide to get counseling with, it is important to keep our minds and perspective in check, to give us tools that we can use if we're feeling a certain way or thinking a certain way. We want to make sure that we are getting help with that. You don't have to be to the extreme to get counseling. You could just be wanting to talk to someone about how you can better um, deal with certain situations or feelings. Okay, and the next thing is self care. Go to your favorite place often and do what you love to do, and do it often. Even if it's getting your nails done, going to walk in the park, going to your favorite restaurant, watching a movie, do those things and more, but do it often. Do it as often as you can. The next is research medications, therapies, stay up to date on the latest treatments for the person you're caring for. Make sure they are also aware of options. Make sure you're talking to the doctors with them about the best possible care for them for longevity and the most possible way to a healthy and just, knowing that you're doing everything you can with the latest research, the latest treatments to help make things just a little easier. Very important. And last on this slide, we want to talk about support system. Again, family, friends, neighbors, mentors, organizations that can advocate for sickle cell, doctors, nurses, coaches, social groups or support groups, and of course, church. Church. These things, these organizations, this group of entities or people, I feel like you're going to need them at some point in your corner. Establish a strong bond, establish trusting relationships. This is going to help bring you peace of mind, self-care, and security. Security. Next, we'll move on to resources and planning. So for financial therapy and financial planning, my husband and I offer financial therapy. Therapy is different from financial advising. Financial therapy taps into your personal thoughts, feelings, and behaviors with money. So it has a mental health component to it. We talk about the behaviors when it relates to how you handle your money. It also provides the social work aspect of it, of finding resources, helping you plan. There's assessments involved. It's a whole thing. And a lot of people don't know about financial therapy. So feel free to reach out to me if you would like to know more about it, if you want to enroll. Um, we can discuss the rate. We can discuss more in detail what it's about, both financial therapy and financial planning. Also, referrals for resources. I am able to make household referrals for medical, education, household items, rent, mortgage, just those things that sometimes we do need a little help with, and makes things a lot easier, especially if you have mountains of medical bills. So if you stay in the state of Georgia, I am able to make referrals for those resources if needed. And then finally, therapy with a licensed professional. My husband is actually a licensed professional in the state of Georgia and South Carolina. He also has sickle cell. He has type SS. So he is able to counsel those who have sickle cell and come from a perspective of, I can relate to you, you can relate to me. And it's just a very powerful experience. I feel when you're counseling those who are dealing with some of the challenges that you deal with, but yet on a professional level, you are able to give them some very real and empowering um, tools to use for those times that arise that are challenging. And if not working with my husband, then we can also help make referrals or contact other therapists on your behalf to make sure you have the right therapist. That therapist has to understand what it is you're going through. They have to be able to give you those tools and not tell you what to do, but tell you how things can get better if you put certain actions in place or certain thought processes in place. That is the whole point of therapy, is we're not telling you what to do, but we're helping you make choices based on bringing certain things to light and giving you the tools to initiate change behavior or the changed thought patterns on your own so that you can live your best life and feel good mentally and physically, and just feel good about your situation and knowing what to do to keep your mind from drifting off into a negative place and just being in a dark space. The goal is to get you out of that and let you know that there is hope. So at this time I can take questions by email. I am so sorry I was not able to attend in real time. I had a scheduling conflict.
We are back, and thankfully, Shana, you were able to rejoin us. And are you able to connect in case there are any questions? And if not, I will gladly read the comments that we've got.
Yeah, so I was able to reconnect. I do apologize for that. I do have a little bit of a connection, but I am near airport, so if you can't really hear me, I did read the comments, and I'm happy to answer any questions while I do have the connection.
And yes, I can hear you. So one of the things that I commented in the chat, and maybe you could expound upon it more, is that it's tough to get these teenagers and young adults to participate in some of these more creative ways of coping and planning. And if they don't like one thing, what's the best way to go about introducing multiple ways for them to express themselves?
Sure, absolutely. I think the biggest thing is meeting them where they are. A lot of times you just got to find out what they like to do in their spare time. What is the trend for them? Or, a lot of them are stuck on technology, but then some of them use that for coping, but then to stray away from that and find other avenues of therapeutic outlets, I feel like you just have to have that conversation. What are your interests right now, or what do you want to learn more about? So meeting them where they are and just figuring out those details so that you can help them find those resources. Like if they are good at drawing, then help them as much as you can. Sorry about my background. Help them as much as you can with like finding the drawing materials or exploring artists that they did not know about. Get them something to learn or expand on their knowledge. And I find a lot of times, because I do work with a lot of teenagers, that most times it's just a conversation and being as real as possible and meeting them where they are.
A conversation or multiple conversations. And, what I have learned from having a 26-year-old that, the onus of being patient is on me. They're still developing those skill sets. Their emotional intelligence is still sometimes even catching up with their age. And so I love that you said meeting them where they are. That's not them meeting us, that's us meeting them, and then walking with them rather than trying to drag them along. So great advice, Shana. Thank you so much. A wonderful presentation. Carla, back to you.
Thank you so much, Shana Andrews. I really appreciate you for being here. One of the things you mentioned for advanced care plan, I know you touched on it briefly, was having legal documents. When I think about advanced care directive documents, that was also something that we as a community have to have these discussions, not only for ourselves. I know myself and Ray had touched on this and did a segment on this in a session prior, but definitely have an advanced directive legal document in place. COVID taught us so much, right? It doesn't have to be you have a chronic illness, but you never know what can happen. And because we know COVID is not gone and there's different variants, it is very important to have a plan in place to know definitely who would make the medical decisions for you. Also, other things, having a living will, those kind of things in order for proper planning. Even prior to my son going through this situation of having a bone marrow transplant, we already had a document in place. So we knew, of course, that we just let this new team know there is a document in place because they did educate us on making sure we have that also, but we already had that in place. So just making sure we have the important documents in place is so important. We are going into our next segment, and I thank you so, Shana, for being present and providing that presentation for us. We really thank you. And resources are so much more important. So if you hadn't gotten Shannon's information, we will pass that along also via email. So this way information this is one of my favorite times of the Powered Caregivers session is our Caregiver Support Circle. Excuse the topic above. I didn't get to change that on this, but we are not talking about renal carcinoma. That was in another segment. We are talking so much now with a caregiver, educated mom, educator and mom of a sickle cell warrior that is here in our discussion with us today. Meisha, are you here? I know I saw you. So
I'm here.
Awesome. So Meisha, welcome to the Empowered Caregivers. I will allow Ray to chime in and tell us a little bit about you. Ray, you can go over. Oh, Ray.
We are thrilled about our patients and caregiver support circle discussion. This session, we are talking about managing sickle cell disease, career, and family, a mother's journey. And I would like to introduce to you, okay, if I get your name wrong, please correct me. Meisha Gay Chatrie is an educator who specializes in special education, behavior modification, and parent training. A few of her career achievements include enhanced special education programs, both nationally and internationally, strengthening educational programs and services through applied behavioral analysis, or ABA, and early intervention, creating and providing various opportunities for parents to partner in their child's care, specifically by designing and directed behavior modification strategies, and directly monitoring implementation of treatment interventions for children and families. Miss Meisha received her BS in psychology and her MA in special education from Delaware State University. She's been a special education teacher for over 19 years and is continuously learning and growing within her profession. She served as a special education teacher in a variety of settings, which include early intervention, middle school, high school, and adult education. Her roles included Director of Student Services, Adjunct Professor, ABA teacher, behavior consultant, parent trainer, and professional development instructor. Ms. Chatrie developed and implemented programs for learners between 18 months and 21 years of age. She enjoys working with families, school programs, and agencies to ensure the success of all learners. And she's developed professional development workshops and presented in a variety of education settings within the New York, Delaware, and Grand Cayman, New Mexico, and Florida area. She believes that her life's purpose is to help individuals reach their personal enrichment. So without further ado, I'm so happy to have you with us today. Let's begin this caregiver support circle.
Yes.
Hi, good day, everyone. My name is Meisha Chatrie. Just wanted to make sure if my friends are like, what's the name? Meisha is fine, but Meisha Gay is my first name.
Thank you. I
And
appreciate
thank you guys for having me.
Thank you. So Meisha, I would love you to share just a little bit about your journey. Tell us that we know that you have a child with sickle cell. Can you tell us a little bit about your child that lives with sickle cell?
So I'll start from I guess before birth. So the year that I found out I was pregnant with Celine, I was told that I couldn't have kids, so I came to acceptance that year. So that year I was like, okay, I'm not gonna have any kids. This is my life. It's gonna be okay. And in November, I found out I was pregnant. And shortly after she was born, I think a week, they called me and said she had sickle cell. So since I've had Celine, I've learned to have to take the good with the bad with life, the balance. I have this beautiful child that I thought I wouldn't have. And then now she's here, she has sickle cell. And it's been a journey for myself, for our family. But when you meet her, Carla, she's a bundle of joy. She's quite a character, completely opposite for me. She's a people person. She loves to be around family, and she loves to be around friends at school. So that's been like a dilemma for me, because I would love to keep her home in a bubble and keep her safe, because a lot of her crisis has happened because of being in school, being in daycare. And I would love to just keep her home all the time. But her personality is like, I want to be outside. I want to be with my friends. I want to be with my family. What event are we going to next? And that's her life. And I'm like, it's a little bit much for me. And everyone helps to take care of her, because we're like, okay, how do we allow her to be her best self, but at the same time try to keep her safe from germs?
Understandable. One of the things that you said was be her best self. And I love that you use that term of being her best self, because as parents, we are so protective, especially learning our child has sickle cell disease. We are very, most of us, I have to say that we're very, we come very informed, but we want to be protective, right? And we don't want to be overprotective, but we know that learning that having a diagnosis such as sickle cell disease, we want to make sure that we're conscious that we're we're preventing crisis and being, proactive. Can you tell me a little bit of how important was for you to get information, to learn about sickle cell when you first learned the diagnosis? A lot of times we learn thereafter when our child is born, but how did you get connected to learn educational information about sickle cell? Was it your doctor? Did you do the research? Was it a community-based organization you got connected to? What was your resource in order to get educational information and make connections?
So in the beginning, I knew I had the trait. Her dad, he wasn't aware. So, so that was like big for us, because we're like, okay, like I've done a lot to like try to prevent, giving birth to a child with sickle cell. So, but for whatever reason, like that topic, because he was never diagnosed with the trait, or he had no idea that he had this. It was quite a shock for us. On the call today, I have quite a few of our support group, but it so happened that her dad, he had an employee who had a sickle cell foundation. So she, as soon as we found out, like she gave us binders, books. His aunt, she's a nurse, she's here on the call. She was there with information and giving us options. Her cousin is also on the call, and they've been, very supportive with telling us how to look for treatment. His cousin also has a foundation, has a sickle cell foundation, and she's also on the call as well. So I've had a lot of support. Celine has a village. She has a huge tribe that is here to support her with nurses. As you guys talked about the mental health part of it, because sometimes you think about like just the medical part, but the mental health part, you're like, okay, well, how do I manage this? So we also have psychologists in the group. She has like a whole tribe to support, but it was a lot of books. Some of the binders, I'm just like, it was so thick, trying to read through all of it. But the discussions and the research and I guess family sharing, and even I found you, Carla, on Facebook, because we have a sickle cell mom group that we're part of. And I was like, why do I keep seeing your name? And so happened that another friend of ours, she, told me she wanted me to meet you. This was last year, but I didn't get a chance. But I connected with you anyway on Facebook, and we've been in touch since. So I have as you say, Celine has this huge tribe internationally and nationally that's been very, very supportive.
Thank you so much.
And
I'm going to let Ray
educated
chime
us
in
along the way.
to ask question. One thing you mentioned was support groups online, so we'll talk more about that. So that is another resource. So Ray, I'll hand it to you.
So I am thrilled to hear about your story and to just read about your journey. And like you, it is faith that grounded me from the beginning and continues to ground me today and will ground me tomorrow and forevermore. One of the things that interested me about your journey that really was similar to mine is your career is older than your child.
Come on.
Which means when your child came,
yes.
you had to rethink that career trajectory. Can you talk a little bit about that? Because I don't think we speak about that enough in the sickle cell community. And help us to understand, some of the roller coaster, right, that you went through and how you made decisions about what you needed to change, what you were going to keep, and what you were going to change.
So I'll start by saying, when I was pregnant, I knew the type of mom I wanted to be. Like, since I was like, oh, well, thank you, Lord God, baby's on the way. But I knew I wanted to be a stay-at-home mom for at least a year. So I had like this plan, like Montessori therapy, Montessori theory, and I believe in art therapy. There's like, I had like a non-conventional way that I wanted to educate her. So I had all that in mind. And so we started like with preparing for like a business. So that helped in the beginning because we're like, okay, like I want to have a business, at least I could have this time to be at home. So when I found out 2 weeks after, I was like, oh, great. So I really have to like push forward with, making this happen because her aunt, mentioned to me like, work is going to be hard. It's going to be different. And so I was like, okay, trying to plan and I'm trying to, like think, how am I going to manage this? 6 months after I had her, I went to work. They said, okay, I needed, to supplement, being an entrepreneur, you need that extra income still. So I went to work and she had a crisis. So I only worked for, I think it was like 3 months or 4 months. And then I was out of work. And then so since I've had her, so she's gonna be 5 this year, I've not been able to like maintain a job for more than a year because every few months, sometimes like depends on, and again, when she goes to daycare. So as soon as I put her in daycare, and I'm a teacher, so August, September, school starts, I'm already being pulled out because I have to be in the hospital. Sometimes her visits are a month. Well, that's the longest this has been, a month. But sometimes it's going like every 2 months she's in the hospital. So I'm out of work all the time. And the type of work that I do, I'm like the advocate, the one-on-ones. I'm there to support those kids. And if I'm not there, they're not receiving their services. So then by law, okay, they need to fill the position. So oftentimes they're like, okay, Ms. Chatrie, we love you, but gotta let you go. So for 4 years, 5 years, I have been able to maintain a job consistently. This is the first year where the school, because of the teacher shortage, they're like, okay, we're not going to fire you, but we can't pay you for when you're not at work. So, so I have a job, but sometimes they're not understanding of like me leaving all the time. They're like, oh, she's sick again. And then you're like, what do you mean by that? But yes, I'm like, this is what it is.
Yeah, it's everything you're saying is so important because, the reality is that not everyone is going to understand. And then we know that we work in traditional, if we work in a traditional environment, the needs of the business, right, tend to supersede the needs of the employees and the staff. It's wonderful when you can work in an environment where there is a lot more flexibility, but that's just simply not always the case. And so, prioritizing, your child becomes something that is necessary, and they get to see that you're present and supportive in their journey as well. So thank you for sharing that. Now, I do see also that Tabitha said, as an educator, do you think that all sickle cell disease children should at least automatically have a 504 plan for school accommodations?
Oh, yeah. For the past year, I've been fighting for a 504 plan for her because she received VPK this year as a 4-year-old. And sorry, I'm using acronyms. So she's in pre-K, and in Florida, it's free when they're 4, but they will count it against her because of her attendance. So I mentioned to Carla a few times that they're like, oh, her attendance again. And I'm like, I can't help that she's in the hospital. And I tried for months to get a 504 plan in place so they won't count her attendance against her. And so at one point I was just like, you know what, we'll pay for daycare. It doesn't matter. Just take her off it. But because the state offers this, they're like pushing it on you, but at the same time, because of your her health, they wouldn't give her the 504 now because she has to turn 5. So when she turns 5, she'll get a 504 plan. And so all year it's been, every time we went to the doctor, we had to get a doctor's note. If she's out sick, so let's say I suspect, this week example, I suspected that she was sick. So I took a day off. I didn't send her to school. So I have to check, okay, how many more days does she have before they're like gonna bump her from the program? So it's like constantly checking that. Next year, I'm still debating, if I'm going to do hospital homebound, because one of the support facilitator that I work with, she was saying that, maybe hospital homebound, and Carla and I also talked about that, maybe hospital homebound until she's like a little bit stronger, her immune system is a little bit up more. then a teacher could come in and work with her. But at the same time, like I have that decision to make because again, she's very social. Like she loves a social life. So I'm still debating if I'm going to have them do the hospital homebound teacher where they'll come in and teach her. But yes, I definitely think someone with sickle cell should have a 504 plan in place, especially for like PE, because I have students at school, they're playing PE, and if they pass out or they don't know, okay, what's going on with the child, at least a 504 plan is in place that, okay, they can't be outside for more than 15 minutes when it's really hot or if it's really cold. So that is very necessary, very important to have in place.
And I'm really glad that you said that. And for those who may not be familiar with 504 plans, it is different than an IEP, which is an individual education plan. A 504 plan is very specific to outlining the accommodations and needs for children with disabilities or other health diagnoses. And I did put a link to more information in the chat box, and you can also Google it for more information as well. Carla?
Thank you so much, Ray, for sharing that and sharing that resource. Definitely a 504 plan is so important for a child with any chronic illness, especially when we think about our children living with sickle cell disease. I will tell you that two things. I was an educator, was teaching elementary, 4th and 5th grade when I gave birth to Shamar, and I had to also think about career change. I had to think about career change, being there every day. It's nice to have summers off, but sickle cell don't know when you have a summer off. So when his doctor tells me about him having his chronic illness, and when I did my research, I said, I need something else. And I actually went into social service working for a hospital. So that actually was a blessing for me. So having summers off and Christmas, nice holidays was great for elementary when I didn't have a child with a chronic illness, but I knew it wouldn't work for me as time progressed, and I didn't know what to expect with sickle cell. But what I did know is that when a pain crisis does come up, it has no initial invitation of when it would come up, and that would impact the schooling of what I would be responsible for of children, educating children. So one thing I had to do is think about career change, and I did that. It took me 2 years, and I went to a different career. The other thing that I also have to mention that you also remember was definitely having that 504 plan was definitely important. Florida is hot. That's where we are. So I had to make sure in that plan, it definitely states that, him going outside, definitely limit that. It was different times, but when his sickle cell actually became aggressive, because I mentioned that he did fine for a very long time. He had some issues with fevers. A lot of our hospitalizations were for infections, like literally infections from the time he was maybe around 4 months old until that's our hospitalizations were a lot for infections. And then his main acute crisis came at 8 years old when he had an aplastic crisis. So I will talk a little bit about that at another segment, but that brought on a real acute crisis. And then so therefore at the age of 12, when it became aggressive, something I didn't want to think of is of him staying home. His teacher pulled me aside and told me, when she noticed a lot of absence, she said, 2 things I need you to consider. Making sure you have accommodations for a 504 plan, and think about putting on a hospital homebound program. And I was like, my baby, as a mom, I didn't want to think about something harsh of taking him out of school. But when I really considered him falling behind and what it meant for me and what it meant for the support that he needed, I needed to actually take him out of school for him to be well enough. That also had made a stretch in what I needed to do, even for a job. I had to make some decisions even at my job. And when I went in and told them, because they was always looking at my attendance when he was sick anyway, but I made sure when you tell a child to make sure you're doing your best at school, make sure you're doing your best at work too. So the productivity that I was doing for even when I was being absent there's a lot of my coworkers couldn't meet the expectations that the job had, meeting those goals, even when they were there for the week. And when they saw that, they was like, this is an extraordinary worker. And when I put in my resignation, to actually, because Shamar was going to have to be hospital homebound student because of the acute crisis that he was having, and for the needs that was coming with his health, they asked me if I can work out a schedule and would I come in as, per diem or think about part-time. When my manager called me down and I was like, look at this. This is nothing but God. So look at the options that you even may have, even at a job, and understand what may be available, because as a parent, you may notice that your child is having more aggressive crisis, and you need to make some decisions even for your household. Even for my household, at the time when Shamar was ill and started to get crisis, we had to look at a time who's going to be home and changing shift. And it was a time when he was in daycare and he caught bronchitis. My doctor said he can't be in daycare. So I had to take him out of daycare, make sure he was home. So we actually had to change shift. We both had to work. We had financial responsibility. So me and his dad, we changed shifts. He had to change his job to a night shift, and we was in the morning. So we was barely passing each other, but we had to know what we had to do to make it work. So sometimes you have to think about how your household changes that you have to make in order to care for that chronically ill child, which is so much more, important, that you're not only feeling that you're there for your child, but also feeling the need to be able to, for the family needs, right? Because I have other children. I have a younger child, younger than Shamar, two actually that are younger than Shamar, and I have older children. So I had to make sure I had the support for them also. So I like that you mentioned that, because mentioned about, even with career and having to think about a 504 plan, and then think about definitely if, what might be best is having, her having to actually be a hospital homebound student. And then in different counties, they have different hospital homebound setups. So sometimes they have you come part-time rather than be a full-time hospital homebound student, and then realize this is not going to last forever. You have to think about treatment options for your child. Do not ignore that there is treatment options out there. Hydroxyurea is actually one of the treatments that helped my son go back to school. When he got on hydroxyurea, he didn't have any crisis for that year. When I'm telling you none, I managed none at home. I managed no hospitalizations. That helped him. Actually, each semester we looked at how his health would progress, and that hydroxyurea made a difference. Then we tried other treatments. Like I said, he was on Dario and Oxbryta. When I noticed that certain changes, because sometimes things don't work all the time, then we made a decision to put him on other medications. So we cannot ignore the fact that there's treatment options out there to help create a quality life for our children. And not only that, we have to think about that organ damage. That organ damage is there, whether they're having chronic crisis or not. Slow organ damage is a possibility. And when we think about that, we need to think about treatments. We need to think about curative therapies. We need to think about what can help them and help to have a quality of life and improved health. Right? So we have to be conscious of that too, as we learn more and as we want the best for our children. So I will let you ladies chime in, whether Meisha or even questions in the audience.
I'm so glad that you talked about quality of life, and are we doing the things that we need to do as parents and caregivers to ensure a quality of life? Now, what I learned with having a son that's 26 years old is that, his idea of quality of life and my idea of quality of life, I had to adjust as he got older. When he was small, I was making many of those major decisions for him. As he got older, there was a point that he was becoming very isolated because of the time that he was missing in school. And I needed to look for ways to reintegrate him into a socialization that would keep him mentally and emotionally healthy. But I also worked with the school in those accommodations. There's not a cookie cutter formula for all accommodations. There are some that are similar across most of our kids, and then there are some that will be unique to your child. But making sure that you are having these conversations with your child, include them in on the conversations around accommodations. You don't want them to feel like they've been othered. You don't want them to feel like, you know, that they're not fitting in with their peers. You want them to understand that everyone has differences, everyone has unique needs throughout their life, but how do we make sure that they still feel that they are part of this group dynamic, which is, you know, one of the values of school in addition to education. And so I think that's important. And then make sure that you're showing them examples of warriors who are living well with sickle cell, warriors who are setting goals and accomplishing goals. That doesn't mean everyone will go to college. It doesn't mean everyone, you know, will have, you know, this degree, you know, on their wall. But what it does mean is that their ability to set goals and meet those goals, feel like that they can meet those goals, is highly dependent on the support system they have and the representation that they see in front of them. And there are many, many examples of successful warriors and warriors who, in spite of, not in absence of, but in spite of having this condition, still have persevered and still have been able to meet some of their life goals and milestones that were important to them. So that's actually really important. When I was in college, you know, I actually shifted my college. I ended up having my son the last year of college for me, and it was really it wasn't by chance. It was really really by the Lord himself, that the way that my career shifted and that I've been able to really support him. I actually have been in healthcare for almost 20 years. I was in blood banking for almost 10 years. I was part of the pediatric cancer and blood disorders clinical team for almost 7 years prior to starting well, it wasn't prior, it was at the same time, y'all, of starting our foundation in Minnesota. But that gave me really an opportunity to have a foot in the clinical setting as well as a foot in the community, and to really be able to merge that and to help not just families learn how to navigate this journey, but I needed that clinical team to better understand what it meant to navigate with the journey with a family, and to understand the challenges of when they go home from their 40-minute appointment with you, we still got to live a whole different life out there. So to see us outside of our vulnerabilities, but our strengths, and to see us in our future, not just in our present.
Yes, thank you.
Sure.
Thank you so much.
Any other, I love, by the way, let's see, Miss Ebony added some specifics about the 504 plan that she has for her daughter. And they are the hydration, those frequent bathroom breaks, no strenuous exercise in PE, no going outside in the rain or extreme temperatures. I'm glad you said that, because y'all live in the heat. I'm in Minnesota where it is cold, 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 cold. And so that is a huge trigger, just as well as extreme heat. She also talked about extended time for testing and no penalty or grade reduction for missed assignments. So important. We want to set them up for failure, not for success. We want to set them up for success and ensure that failure is not all over their records in their academic years. And that absolutely is important as they navigate their educational journey from the time they're in grade school into college. In fact, college may not have 504 plans, but they do have ways to achieve accommodations through disability offices and things like that.
Yes, great. This is great information. And
Yeah.
thank you for those that's included, in this. I love this forum circle is one of my favorites. I'm gonna tell you right now. So chime in and put your information in. I know we are going into the closing, but if you have a particular question that you want us to answer, chime in right now. One of the things I wanted to ask you, Meisha, is that your daughter, you spoke about quality life. And one of the things, so what do you have her involved in, or what does she like? As a parent, I know it's important for us to kind of explore and let our warriors just be great at what their interests. So can you share that?
So she loves to dance and she loves to swim, but she's always been sick every time she's in dance. It's like my mom is always like, okay, well, keep your mask on. And she's Jamaican, sorry. That's my Jamaican accent. So she's like touching everything when she's in dance. She's on the floor, sometimes rolling. And like within a week or two, she's sick. She has a crisis. Same with swimming. And thank God for the Sickle Cell Mom group. Because I, found that she needs that the wetsuit. So
Yeah.
she has a wetsuit that she could wear now. Like we went on vacation in December and they said the pool was heated. So I was like, okay, good. But it wasn't heated enough. And she had a crisis when we were there. So I don't know, the things that she loves sometimes is like, oh man, like she loves this so much, but at the same time it's like, we have to like, I guess, okay, like how long? Once my best friend took her to the pool one time, and I was like, okay, you have to take her out and like dry her off and like change her clothes, make sure she's warm every few minutes. So it's like you have to like plan for the things that she loves. And I don't want to like restrict her too much. But I had to pull her out of dance this year, and then we had to stop a little bit because she had a crisis both times. And she also wanted to play soccer, but the back and forth movement, like we worry about that. But I see some parents on the Facebook group say that as they get a little bit older, it gets a little bit better. So again, I'm just praying and hoping that that's true. As she gets older, it will get better. She could do the things that she loves.
You're right. And I think that what happens is as they get older, they begin to know their bodies. They begin to know what their triggers are. And that's so important. And in fact, that should be part of the conversations that you're having with your children is, not in a blameful way, but in a knowledgeable way. And our kids, I can't tell you in the winter how many times I would send my son to school all bundled up and everything. And he would come back with half the items I gave him. Like, how did you stay warm? That's not help. And what I had to do is help him to understand and make the connection between the way that he dresses and the way that he takes care of his body and the outcomes that he can get. No, we cannot prevent all complications. We can't prevent all crises, but there are some that we can better control. We can be proactive rather than reactive. And some of our kids, particularly boys, they learn a little different.
Yes.
And so you have to be patient, and you have to, like you said, like was said earlier, meeting them where they're at and having the conversation in a way that's most meaningful to them. The other thing is just regarding just navigating their journey is including out of the box methods of coping. So whether that is integrative medicine, whether that is, therapy or counseling, psychology, making sure they have an outlet. Listen, I know I'm a good mom, but I'm not the end all be all. And I can't take the position of, I'm your hero in all things. I needed him to understand what it means to develop those relationships where he can feel comfortable in talking about what he's feeling, even outside of just me. Because especially for boys with their mom, You know, there's things that they're going to feel more comfortable talking about and things that they're not. When he started talking about priapism and the challenges that he had, I called on my village of good, powerful men who could actually have those conversations with him. I could, but I felt like having it come from another man was really important to his self-esteem and his identity as he developed. And so, and integrative medicine, there's so many different things that we can do that help to support our children as well. I am never an advocate for no medication. I don't want our children to suffer needlessly, but I do believe that managing sickle cell disease is like baking a cake, and you need lots of different ingredients in different amounts, and everybody's cake is ever so slightly different. And so, you know, the cake that we were baking time and time again, you know, required so many of the things that have been mentioned in the chat box.
Thank you so much. And I saw so much great information in the chat box. So I thank you for sharing that information, everyone. I really, really thank you. And definitely we love, like I said, we're family here, right? We can ask questions. We'll take as we go into our next we're wrapping it up. So we'll go into just our slides to be able to wrap this up. So I thank you. So we'll take one last question. And if Ray, if you see any question, because I can't see the box when I
am looking now. I just think that this is wonderful. You have Tiffany said she didn't even know about an accommodation for no grade reduction for missed assignments. This is why I love this session.
Yes.
And it's due to being homesick from pain crises on her daughter's 504 plan. She's going to add that one and other accommodations that she were not previously listed. Shana, I probably butchered your name. I apologize. Homeschools her warrior, and absolutely that is an option for many warriors, in fact. And it's just finding what works best for you and your warrior and your household. Ebony says that her daughter is 0 for 7 with regular pools, but has had crisis with natural water or salted pools. My son loved swimming, and you know, Minnesota has some really odd type weather. He would have crises, and he would get done with his crises and be like, "Can I go swimming again?" Listen, little boy. The pool and this crisis, I'm gonna need you to understand. And he would go with his friends, and next thing you know, he would be in the pool, and next thing you know, he'd be in a crisis. So we had to learn it because I didn't want to take away something that meant quality of life to him. Yes. So I needed to be creative. I needed to have conversations. I needed to find resources. I needed to figure out what was the sweet spot for him, because what happens is we inadvertently begin to take away all the things that are meaningful to a childhood. And if we're not careful, we're either not replacing it with something that's equally as fulfilling, or they feel like everything I want to do, I can't do. And that absolutely impacts them emotionally, psychologically, and it will accumulate over the years. And so it is important, where there is a sweet spot to be found, try to find that sweet spot. My son loved Little League. He would be out in the field, and every time he would turn around, I knew that he was kind of hunched over. I knew he was having pain, and he would turn back. I would stand up, and he would turn around, and he would shake his head. No. In other words, please don't take me out of the game. Leave me in. But then we would have conversations. Then I would hydrate him, learn to hydrate him well, and pre-medicate him so that he could do the things that were meaningful to him. Right. And then there were times that he was like, I tried it. I ain't doing it no more.
That's true.
It's a journey for all of us.
Yes. Thank you so much, Ray, for sharing that. That information was really great and helpful. And one of the great things that you said was that you allowed him to do what he wanted to do. You didn't want to take from him. And sometimes it's hard for us as parents, but we have to allow that we have a different thing about quality of life than they may have a different aspect of quality of life. And we have to respect that in every aspect. So thank you so much for sharing that point. And Ray, I want to say Ray's son, I tell you, Trey has his own unique ways of bringing across even how he's grown into adult. He is so funny, but yet set in his ways, and he's an awesome young adult.
So where he gets that from?
he has learned his body. So that is one of the awesome things, because we want them to learn their body and their limitations, and we want to be respectful and not even limit that also. So understanding that. So I like also that, Meisha, great that you also incorporate that your daughter loves to dance. It's not that you stop dance, you actually put her in dance, right? But you're now monitoring on what might work best and trying to figure out what may work best. So we spoke about so much today in this circle. I'm sorry we have to cut it short, but we had a great time. It's always nice to share resources, make connections, and this is where we want to be able to make those connections. So definitely, I'm so glad to have each and every one here today at our Empowered Caregiving Forum, and thank you all for staying out the course till the end. I thank you. Here's some more resources. So we always provide resources. Just know that a lot of this information we provide is ASH guidelines, Beyond Sickle Cell Management, which is Change SCD, the Sickle Cell Association, the Sickle Cell Association Coalition, Disease Coalition, the Foundation for Sickle Cell, the Sickle Cell Disease Foundation. That's another resource, and Sickle Cell Connect, which is Be to Match. We, in the packet that you're going to receive, actually swag bags are going to be mailed out, and we have in that swag bag, we have a folder of resources, and myself and Ray was very intentional about providing a list of resources, not only for education, but for education, all kinds of things. We know that it's so important to have resources and make connections while we're on this journey of sickle cell. Please know what's not here is also that sometimes you might see sickle cell surveys or caregiver surveys that's related to sickle cell or chronic illnesses that come out in the community. Please make sure that's another source of income. I found that to be so easy to make. $300 probably was the most I did for a survey, and sometimes $100, even a minimum of $30. It pays a bill. That's what I care about. It pays a bill. So I'm going to do the survey because I know I can use it to pay a bill. So just know that even though that you may be going through different things with your child, there are resources out there to be able to help. And those financial resources are definitely helpful too. Understand now too that COVID brought a new era, so there's more online jobs. So look into what may meet your ability of time and also what may meet your professional skills. And please, never stop advancing on your professional skills. There's always so much to do and learn and get acquainted to what you can do and explore to be you. And now that we got more education online, that's another thing that you can do, right? So, and jump out on faith. If you have a business that you wanted to start, learn more about your business aspect, and definitely chime in to learn from other professionals and see if this is what you want to do, really want to do, and is it affordable to you to launch your business, and how can you attain income from that business? Understand that also. So I want you to know that definitely stay in the gear to be an empowered caregiver and empowered warrior. So glad to have you here.
Yes.
So save the date for July 22nd and then October 7th. We have our Empowered Caregivers Forum coming up. So we know those are our 2 dates. We have 3 segments for the year. And then in between, just know myself and Ray have so much more to offer. So if you look on our pages, always check with social media. If you have any questions, you can also email us. Our information is here. In June, I have our sickle cell and chronic pain management symposium coming up. I have the save the date that went out. So that's on June 23rd and 24th. That will be coming up. We have a great segment of experts speaking, and also we have our Saturday is dedicated and kind of planned in by our young adults. So we have discussion sessions, we have panel sessions, which also will be on gene therapy, will include gene therapy, our panel. We have those that have been through gene therapy. We have those guest speakers that will be on there, and those that have been through bone marrow transplant is also included on that in our symposium. And then we have other experts that will talk about topics of sickle cell, pain management, as well as just sickle cell management on a whole. And then what I also want to encourage your young adults and adolescents to join in on the symposium. We want them to learn. This year we are working on offering our CME credits. So we are excited. And then Ray has a segment that she does on cooking. So we know that it's so important for what we put into our body also impacts our productions of cells. So Ray has a lot to offer. Ray, can you just share a little bit about what you have coming up?
Sure. So one of our organizational values is education, but education isn't always just strictly directly about sickle cell disease, but it's really about how to live well with sickle cell. So one of the things that we did last year is we did online cooking classes so that people understood how inflammatory ingredients that are in all of our food on all of the shelves, how they impact our health. And so we did live cooking show segments, and then we also have a YouTube channel where we upload all of our education videos. I think we're up to, I don't know, 70 some videos now. And so you can find what you need when you need it most. It's on demand. And just being able to connect with other families, other individuals, other warriors. I encourage all of you on this call, you don't have to take this journey alone. The fact that you are here and participating in the Empowered Caregivers Forum. But if you have not connected to a village, if you have not felt the most empowered when you get off of these calls, I encourage you to reach out. We can help you to connect with a village. We can help to connect you and feel like you are better supported, because the reality is that we suffer in silence even as caregivers. And it's important to know that you're not alone in that. It's important to know that it's nothing that's wrong with you. This is a tough journey. None of us asked for it, but we were given it. We have an incredible strength that naturally comes that we have, but it's also a strength that we learn to tap into that we didn't know we had. And so if there's ever a time that I can support, much like Carla can support, by all means, reach out to us. That's what we're here for. And then if you have questions along the way, just about your journey, I will always say, everybody ain't going to parent the way I did. I'm a unique parenter in a lot of different ways. But what I can do is share my journey, share some of the things I did right and some of the things I did wrong that I learned along the way as well. None of us are perfect. And so I'm just glad that we have this safe space to be ourselves and to get to know one another and to share these best practices about being warrior parents and empowered caregivers.
Thank you. Great. Thank you so much, Ray. I just want to take the time also to thank our sponsors, Pfizer and Medic USA, for supporting and always having interest to understand and learn more about sickle cell, as well as providing a resource and definitely honing on education when it comes on to sickle cell disease. That interest and that dedication is actually there. So we are thankful for our partnering sponsors.
Very grateful.
Yes, and I want to thank you also to our speakers, their family, and our caregivers, and our supporters. So we know that it takes a village, and we are here with our village to make sure that we are learning together, making connections, and gathering resources. Please register for session number 2. That will become available tomorrow on Eventbrite. So session number 2 coming up for July 22nd will be available on Eventbrite. So you will definitely want to register, and our concentration will also be on sickle cell trait on that segment. So you will not want to miss the great resources that's provided. If you have not registered, you can't receive a swag bag if you haven't been here attending. So if you have registered or somebody gave you a link, please make sure that you connect with me, give us your email so we can have you connected, so we know that you are here, and we want to make sure you have a swag bag also. Also, I want you to please look out for our survey. We'll have a survey going out. And I once again want to thank you for joining us and enjoying us at the Empowered Caregivers session today forum. So we thank you.
Thank you, everyone. And yes, Eventbrite. If you go to Eventbrite, you can just put in Empowered Caregivers Forum and it should come up. I encourage you to follow. You can follow Carla's page. You can follow our page at Sickle Cell MN, Sickle Cell Foundation of Minnesota. And that way you'll be notified as well every time a new event goes up. And that's one way to stay informed. So we hope to see you next time. We're so glad you made it. Have a blessed, wonderful, powerful weekend, and we will see you in July.
Yes, or sooner. Come to our events. Thank you.